Honorable Ministers, Your Excellencies Ambassadors, CEOs, Vice Presidents, Vice Chancellors, academicians, honorable distinguished guests, honorable partners, and ladies and gentlemen, good morning. My name is Honorine Muteto. I am from Hills Connect, one of the organizers of this amazing event, the second Rwanda Nordic-Baltic Business Forum. It's my great pleasure to welcome you once again to this event. And this event has been made possible through the cooperation of the Embassy of Rwanda to the Nordics and the Baltics, and Hills Connect and Remote, with great support from RDB, the University of Rwanda, and Ines Ruhengeri, a university in Rwanda. I would like to start by apologizing for the changes made in the program. There has been a lot of changes made since yesterday, and that is because due to flight disruptions, as we all know, that there has been a lot of those recently. Today's program will be focusing on two thematics, key thematics, which is health and education. And to begin our program today, it is our honor to hear opening remarks from one of the leaders who are shaping Rwanda's future in health. I would like to invite His Honorable Minister Yvan Butera to give us the opening remarks of the day, the Minister of Health in Rwanda. Thank you. Yeah.
Right. Good morning. I think for most of the people, it's a bit of a weather change. Where you're coming from, it's a bit colder than here. So I think we are happy to have you, and welcome to Kigali and to Rwanda. I know this is day 2. My colleague was here yesterday, Jean-Guy, the head of the development agency. I'll prepare the speech, but I will not say it because it's going to be boring. But because for most of you it's the first time that you get to Rwanda, I'll just share a bit of experience of what we've been working on together, and perhaps what we can embark on further going ahead. So first of all, I'd like to thank the organizers that organized this convening. Thank you so much for our guests, for leaders, excellencies, ambassadors, distinguished guests, ladies and gentlemen. It's truly a pleasure to have you here in Rwanda, and thank you for making it. So I'll just give a brief experience of the Rwanda's journey in the health sector, which can reflect many other sectors if you want to expand to it. You know, we started rebuilding this country about 32 years ago now, and you can imagine rebuilding from scratch how things were tough back then. But quickly, in 3 decades, I think Rwanda has registered the quickest gains in health ever registered anywhere at any point in time. In terms of life expectancy, in the last 25 years, a growth of about 25 years of life expectancy. Reduction of maternal mortality in 25 years by 80%. Infant mortality, 80%. All these are tangible gains that were anchored in good leadership, but also very good partnerships with many friends and colleagues around the world. So where are we now? Where we are now is that we are seeing people living longer, children no longer dying of preventable causes, mother no longer dying of preventable causes. What we are focusing on now is the next step. From preventing people to die and making sure they live, but to go into now discovery and innovation. And I'll share just a few examples. The first end-to-end plant of mRNA technology on the continent was built here in Rwanda right after COVID. So what we bring here, you might think that Rwanda is a small country geographically, but really in our spirit, we don't think that we are that small. I think it's something that resonates with some of the countries that are represented here in the room, where the size does not necessarily mean what you can do. So I think it's a natural convergence of maybe ideas, of thinking, and of vision. So what we think we bring is to move from idea to action. Anything we discuss in terms of innovation, I know there is academia in the room, I know there is medical technology companies, innovation hubs. Anything we can craft together, I think we'll be able to deliver. So I talked about the mRNA plant, so that's on the technology part, but even on the continental organizations that kind of streamline things together. I'll just give you an example. Globally we want to elevate the level of quality of things that we do, and regulation is a key aspect of it, right? So in Europe, you have the European Medicine Agency. Here in Rwanda, building on our very young Food and Drug Authority, which also benefited from partnerships with the European institutions. This is an organization that's about maybe 7 years of age. We've achieved a good maturity level on the continent. About 8 countries have that on the continent. But above that, when the African Union sat and say, how do we now bring all African countries together, and so that they can collaborate, so that we have regulatory affairs, be coordinated, especially in the area where research and development is developing in terms of new diagnostics, new therapeutics, new medical technology tools. Where do we bring the headquarters of this agency? So Rwanda actually hosts what we call the African Medicine Agency, which is the continental hub and equivalent of the European Medicine Agency, like I talked about. So it's just to show you that, we look at things end to end, be it in life sciences, in medicine, in regulatory affairs, and other things. So we welcome you to partner with us if you want to be in a country where things get done, which I know you like as well, being practical. So we'll be happy to do that. I want to stress one point. Human capital development, as you will understand, will be the cornerstone of the development of the country. And one key area has been into health workforce development. 2 years ago, when we started a reform that we call 4x4, which means to quadruple the workforce in 4 years, I'm seeing the principal of College of Medicine and Health Science will talk about it maybe in his panel later on, Professor Abraham, but I'm also seeing leaders from other academic institutions here in the country. We had one skilled healthcare worker per 1,000 people. Yet the basic minimum should be 4 per 1,000 healthcare workers. The importance of healthcare workers is, as you all know it, and because of different shocks that we've had, and it's a global issue, we were really at the bottom. But 2 years ago, we launched this reform. 2 years down the road, we've more than tripled our capacity to train healthcare workers, in some areas more than others, and we also thank you for your partnership here. We used to train, let me give you a quick example. We used to train less than 100 midwives per year here in the country. Right now, we are training an average of 1,000 per year. For residents, specialists, some programs were taking about, let's say 12 residents per year. Now, for some, we are taking about 200. And for that, there are a lot of investments and partnerships. We expand training sites, moving from 5 to 15. We do a lot of international partnerships. Some of them are supported by some people in the room here. I can give you a quick example. For our pediatric surgery program, we have good support from the Martina Hospital in Sweden that are training our pediatric surgery residents and fellows to be able to get to a good level. Some other institutions also support in the area of midwifery, but we welcome many others to support in clinical care, in teaching, but also in research. A lot of research is happening here. We do, basic, fundamental research. An area of interest I want to invite you to join us in is an area of translational research. If we can move things from basic descriptive biological research to go to translational research, especially in areas of advanced sciences such as genomics. It will be an area where we would be very happy to partner so that we can move now from, from the lab now to products, if we can, because there's untapped things that we need to work on here. And this is where we also invite the private sector to find a way to invest in this area. I can give you examples. Rapid tests for many infectious diseases that we have on the continent. You're talking about a continent of 1.4 billion people that is projected to be where there's more growth in terms of people, but also of the economy. Everyone is getting concerned by health. So there's an area also for private sector to invest into these, what you would call basic diagnostics that you can use, rapid tests, etc. We don't have many on the continent, I can guarantee you. But also in terms of drugs, this is the cradle of humanity. You can imagine where life started. So there's maybe a new molecules that we can discover here that has a potential to serve 1.4, 1.5 billion people on the continent. So I tried to, as I told you, not to read from a speech, but to give you an overview of how things are. So we welcome you to partner with us in the area of life sciences, of education, of discovery, and we thank you so much for all that you do. We have a shared vision. Please feel at home. I hope the organizers are not just keeping you in the room, that you'll have time tomorrow to go and explore a little bit the city and the country. And we'll also be happy to follow up maybe on specific things with different partners here. So I don't want to take much more of your time. I'd like to thank you for your partnership, for your friendship, for your commitment to drive mutual beneficial partnership for the Nordic countries and Rwanda, and through Rwanda, the continent as well. And I wish you a good stay here in Kigali, Rwanda, and wish you all the best for the rest of the summit. Thank you so much.
Yes, now it's working again. Thank you very much, Minister, for those insightful remarks. And I would like to give a little announcement before we continue into the program of the day. Today in the afternoon, at the same time as some of the panels, there will be a side event on the comparative projects about inclusion in education. And in this event, Rwanda's perspective will also be shared. There has been shared a Zoom link to everyone who is participating today on their email. So if you would like to participate in that, then you're very free to participate in that rather than the other panels. And so on that note, let us move to our first panel discussion of the day. It is titled From Strategy to Systems, Rwanda Nordic Health in Action Global Health Hub. And this conversation will explore how the partnerships between Rwanda and the Nordic countries is translating into strategic vision, is translating strategic vision into practical health systems, innovation, and collaboration. I would like to invite Her Excellence Ambassador Dr. Diane Gashumba, as she's going to be the one moderating this panel. You're welcome, Ambassador. The floor is yours.
Apparently, I will be alone on this panel.
I will be welcoming the panelists as well. I would like to, and I apologize if I say your name the wrong way. I would like to invite Prof. Per Karlström from Aarhus University. A round of applause for our panelists, please. And I would like to invite also Dr. Abraham Hailayamek-Mitiki. You're welcome, Doctor. I would also like to invite medical doctor Abebe Bekele, Dean of School of Medicine at UGHE. And I would also like to invite Mr. Thierry Habyarimana, Dean and Faculty of Health Sciences at Ines Ruhengeri. And lastly, I would like to invite Miss Marie-Rose Kairangwa, Country Director at GPEGO Rwanda. Thank you, everyone, and can't wait to hear what you have for us.
A very gender-balanced panel, right? Thank you so much, Honorine. We're going to talk about moving from strategies to systems, but I like most the last part of this, the title of this panel. It's Rwanda Nordic Health in Action. We need actions. I will start with Per from the University of Aarhus in Denmark. When I was appointed ambassador to the Nordic countries, I was told not to call people from the Nordics during weekends and after work. But I was positively surprised by all my colleagues, ambassadors, and I really want to thank you so much. I call you during night, I call you during weekends, and you always speak. Thank you so much. And Professor Per, we got connected after the announcement of the Danida grant that was including Rwanda as a new Danida beneficiary following the opening of the new Danish embassy here in Rwanda. And I called him, I think it was a Sunday, and we spoke. And we spoke for a few minutes. We had other calls with University of Rwanda, Abraham, Abebe from UGHE, and Charlene from Ines Ruhengeri, the Deputy Vice Chancellor. And we agreed that we are going to build a quadripartite partnership around global health. And it ended up with a good agreement, very practical agreement, to establish a hub for global health here in Rwanda, where the 4 universities will work together. My question to you, Professor Per, is what can Rwanda and Denmark expect from this global health hub? Listening to the minister, we need concrete actions.
Yes, I agree very much. Thank you very much, Diane, and thank you, everybody here. Maramutse, Morakose Chane. I'm so happy to be here. I've been lucky to collaborate with Rwanda for the past 15 years, but flying in and out. I'm actually a family physician by training, but a global health professor, and have been educating Rwandan PhDs in collaborative projects, twinning PhDs, always partnering, one from the global north with a Rwandan candidate here, and it has been an amazing journey. We've really learned from these mutuals, so that is really what we can. We have shown that, and I think that's very much what you allude to, Diane, this about moving from all these strategies, all the fine paper, all the words and the harmonies, to actually go out there, going into the field. We've done work on a manual for psychoeducation for people with bipolar diseases, people that don't get any attention whatsoever here, and which you can actually do a lot just by training people to speak to them about their conditions. We've managed to do this in a randomized controlled trial showing amazing results. We've done work in the primary healthcare clinics of Rwanda about communication between health professionals, which these places are run by extremely valiant and very knowledgeable nurses at these levels. There are no doctors. And we've done research there in these areas on communication between patients and health professionals. And both ways in these twinning PhDs, there's been equal knowledge gained by the candidates here in Rwanda, but also from the Danish participants. So we can go a long way, and we particularly can because we work, as you do, 24 hours, 7 days a week, 306. Because my wife was also a little bit, well, who is this lady calling you every Sunday morning? And you speak for hours. So we have a particular relation there. And thank you for being so instrumental in creating what we are about to launch, and we will hopefully speak a little bit more about that.
Thank you. Coming to you, Professor Abraham, the University of Rwanda has benefited from Sweden's support through SIDA for a long time, more than 23 years, and we've done a lot with Sweden. We've trained 100 PhDs candidates, and with the Swedish Institute, we've trained more than 400 master's degrees, which is really commendable. But when it comes to health, although we have good partnerships, for example, Electa Foundation supporting Rwanda toward the elimination of the cervical cancer, we also have Electa as a company. We buy good equipment, radiotherapy equipment from Electa, but we also have other examples of projects in health. What do you expect from this hub that we are going to establish together with the Aarhus University, building on what we achieved through SIDA and other partnerships you've had with Nordic countries?
Thank you, Ambassador. Yeah, your Swedish program, as you said it has benefited a lot, not only University of Rwanda, but across the country. By the way, even from medicine and health, there are areas like undernutrition and also infectious diseases where people have got training and still ongoing. With this hub now, what do we expect? We have several programs in our college now. Across the college, we have more than 110 accredited or running programs. So through this hub, we can improve our teaching learning, and also we can do needs assessment in the industry as well as in our institution, and can provide capacity building short-term trainings, as well as we can also generate new need-based program so that we can respond to the need of the industry. On top of that, we can also see our ongoing curricula, if they are really pertinent to the ever-changing disease burden and health needs of the global condition. So we can adjust, we can align our curricula, and we can also update our teaching learning methods to align with the global needs, with the aim of developing the future health workforce of the country as well as the region and beyond. Yeah, that's my expectation as on behalf of you all.
Thank you so much. I will pass on to the civil society for more energy. The lady from Japaigo. We've worked for a long time with the US government, and Minister Ivan highlighted the achievement and the status of some of the key indicators in Rwanda. I would like to hear from you, Marie-Rose. How did we manage to move so fast and with positive achievement in collaboration with civil societies, maybe specifically with the institution you lead, that is JAPAIGO. How did you manage to collaborate with the government of Rwanda and record such great success?
Thank you, Honorable Ambassador. Good morning, everyone. I'm happy to be here. As they said, I'm Mariros Kairangwa, representing JAPAIGO in Rwanda, in affiliate to John Hopkins University. And I'm happy to be with those academicians, very respected one, we respect here and globally. As Ambassador said, and Honorable Minister also correctly put it, in Rwanda, the progress we had was also being able to coordinate partners. From the JAPAIGO perspective and the other international NGO and the national strong NGOs that are working closely with the Ministry of Health, some key factors can be mentioned. First, why JAPAIGO has been really successful in working closely with the ministry. First, it was because of the trust and transparency and accountability, where we make sure that everything that is done here is government-led, but also the government of Rwanda is a very welcoming government. You bring ideas, you are welcome. So we have been able to really create this trust. Number two, we were able also to propose something that is aligned with country priorities. You come with this support, but also you are able to be aligned and to bring those innovations from global evidences, because JAPAIGO is country-led, but globally connected. So we have in country and at our headquarters in the region, some experts that are bringing in the country scalable evidences from WHO, from other institutions that are providing guidance. Number three, it was to always have this length, this in mind, the health system strengthening. And it's clear here, it's a resilience. So we were able to not coming with service delivery for one-time result, but also how are we building together with the ministry, with other partners, that system. So also because of the landscape changing, we were able to be resilient and still relevant in that challenging time. So in one word, I would like to say that we make sure to have that trust, but also to build capacity of healthcare workers locally so that they have that sustainability of maintaining the health system. And the government is always in drive seat. Thank you.
Thank you so much. Thierry from Ines Ruhengeri, you're also part of this tripartite collaboration. And I know your university is also connected to the community. It's good to train health providers, and you've heard from the minister about the 4x4 strategy that is aiming to increase the number of health providers, but also the quality. I know your university is very close to the community and is located in Musanze district, right? And despite the progress made by the country, when we look at HIV trend, when you look at mortality, maternal and child mortality, as Minister said, we've done a great job reducing maternal and child mortality. We've done a great job stabilizing HIV prevalence and many other indicators. Here in Rwanda, almost all women deliver at a health facility. Almost all our kids are fully vaccinated. We are, I think, the first country with the highest rate of cervical cancer vaccination. I think we come before Sweden. I want to ask you, beside the academic side that is very important, what do you expect from this hub to solve, when it comes to solving issues that are within the Musanze society? I'm not going to mention the stunting issue. I want it to come from you and to tell the minister how you want this hub to solve some of these issues. Because the three of you will drive this hub. And I know Denmark is ready to listen to us. They don't impose, Nordic countries never impose. That's the difference with some other countries that I'm not going to mention here. I don't want to sound undiplomatic. Nordic countries like dialogue, they cooperate, they never impose. So up to you. What do you expect from this hub?
Thank you, Honorable Minister, and good morning to everyone.
He's promoting me to the rank of minister.
Yeah,
No problem.
I think Ines is one of the universities in Rwanda that is supporting the Minister of Health, and as the Minister stated well, we are one of the youngest universities, but which is very proactive in terms of providing solutions, in terms of training health professionals. So far, we have started with training diagnostic professionals, and if you can go in almost every health setting in Rwanda, you will find someone who has been trained at Ines Ruhengeri, especially in the laboratory diagnostic area. So through this global health hub, we think we need to sustain the gains of the country, especially those which have been well stated by the ministry. And Ines want to be one of those leading institutions that can sustain the training of the professionals. So, so far, we don't have people who can sustain those kind of gains in terms of innovation, in terms of providing specific solution to the community, not only in Musanze, but also in Rwanda. So you mentioned that we shouldn't talk about the stunting, but we have a number of health concerns which needs that to upskilling the capacity of health professionals, and especially at the conducting studies which can really, provide solution to the community in Musanze. Especially, you mentioned that nowadays we have been able to decrease at a very high level the prevalence of HIV, but also we need to sustain that aspect in terms of cervical cancer diagnostics or prevalence. So we need people who can be proactive in terms of conducting studies and research, so that we can have that sustain those gains we have registered in Rwanda. So through this partnership, we want to learn from the Nordics, and because the idea, I think, which has been brought, we used to send people being trained abroad. Some of them are back, others are not. But we think that this kind of partnership will help to train people here, of course, with the partners in Nordics, but also responding to the questions of Rwandan people, not only, working on the other side, let's say, research. And the minister stated well that we have to conduct the kind of studies which are in translation medicine, those kind of studies which can help at the level of community, as well as with the support of the other universities. I know that University of Rwanda and the University of Global Health, they have a quite an advantage or an experience in terms of training. So we will build in that national experience, leveraging also to the experience from Aarhus. Is that correct? Yes.
So operational researchers.
Yes.
We
Thanks so
need
much.
the new devices that are in the Nordic countries, especially in Denmark. Life science is very well developed in Sweden, in Finland, in Norway, in Denmark. We need the new devices to be tested here through this hub. We don't need thesis that goes to cupboard. We have enough. We need operational researchers, if I understood well what you
Exactly.
said. Abebi, last but not least, University of Global Health Equity has done a lot in this country, also supported mainly from the US. And you are very well connected to the community. My daughter had the privilege to be an intern at University of Global Health Equity. And the best thing she learned when she was in Butaro was to connect with the community, the population. Tell us what you expect from this partnership with Aarhus University.
Thank you, Madam Ambassador. Good morning, everyone. Thank you for the invitation to join this panel. I'd also like to acknowledge the presence of the Vice Chancellor of UGHE, Professor Phil Cotton, sitting behind. I represent the UGHE, which is about 11 years old in Rwanda, as compared to University of Rwanda. I guess we are the grandchildren. But we try our best to support Rwanda and its goals towards equitable and safe access to healthcare. As the Minister indicated earlier, we are huge supporters and proponents of the 4x4 initiative. So this PhD collaboration, in our opinion, will have three major benefits to us. Number one is we strongly believe quality healthcare is contingent on quality education. Unless there is quality education in institutions, we cannot guarantee quality healthcare to the community. This directly involves the people in Butaro, in Borera, where we are located. The more PhDs there are, the more quality education there will be, and access and quality care can improve. The second is inter-university collaboration. We already have working relationships between Ines Ruhengeri, University of Rwanda, and UGHE. This collaboration broadens the horizon for us to collaborate more, to learn from each other, not to compete unnecessarily, to use our resources appropriately. We have discussed internally, if there is a PhD program going on at UR, UGHE will not duplicate it, and vice versa. Our main objective is to produce the necessary human resources to support the country, and if not, the region. The third is to produce the researchers that actually do impactful research, because PhD is mainly research and education. To help young people in Rwanda be researchers that can improve healthcare, address real problems in healthcare. A couple of years ago, the late Prime Minister of Ethiopia once quoted, "If you are training PhD graduates who tell me the fish from this lake has 2 eyes, then I probably will not approve your program." So we are very cognizant of this. We want to produce PhD holders, researchers actually contribute to problems and healthcare in the continent, in the country. Thank you.
Thank you. Thank you. I will ask every panelist to tell us in one word something innovative you have in mind from what you've been doing, one innovation you want to be taken care of through this hub, because we are going to pass to the operation plan of the MOU that was signed. And I'm sure the Minister of Health will assign someone to sit in this steering committee to make sure that the priorities of the ministry are taken care of. Let's start with Per.
Thank you so much, and it's so true what you're saying, that if we have to prove what we have written, that's going to be the challenge, and of course what we are here to work for. I can just, if you allow me, I'll just say we will launch the initiative on Monday, the 27th of April, where the faculty management of Aarhus University will all come down here, and we will gather all 4 universities, and from then on, you know, history will change, yes. No, but we are very much ready for this. And if I can take the opportunity here to, again, acknowledge my colleagues and the way that we've been able to develop this together.
One word.
One word, yeah.
One word. Action.
But it is really not about being imposing. It is really this, that we are in this together. Mm-hmm. So it will be, what we are doing is we are having collaborative advantage. Mm-hmm. I think that would be my 2 words.
Thank you. Abraham?
Can I use 2 words? Educational transformation.
Thank you.
Two.
Abebe?
I would say partnerships, and if I'm allowed another word, is quality.
Thank you.
Partnerships deliver. We have seen it in the world. Second is quality. Quality education translates to quality care.
Thank you. Thierry?
Community-oriented research.
Thank you. Marie-Rose, advice. 1 word from experience.
Listen first, finance with flexibility, avoid complexity, and listen to the government.
Thank you. Applause. And innovation?
Not so much on innovation, but about investment.
Okay.
Because there was a lot of talk of that yesterday. Mm-hmm. All of you people here who are in that trade, invest in us.
Yes.
All right? We are open for business.
Good. And the 3 universities, yesterday Nilu challenged us. She said she met African ambassadors in Oslo, and we talked as diplomats. She couldn't hear what our government put on the table. Nilu, I challenge you back. These 3 universities have already committed to invest in the hub. They are not just waiting for Aarhus to finance this hub, they already committed. So last but not least, I want to inform you of the upcoming Africa Nordic Health Summit in 2027 in February. Probably, tentatively, 11 to 12 Feb. So book your calendar, and we are going to talk actions. The first edition was hosted in Sweden, very successfully attended, and we decided that the edition in Rwanda will showcase actions. We have a partnership with Norway around health. When I was in the Ministry of Health, I saw Norway coming to support the health management information system, and our data system is one of the best, thanks to Norway. And we want the University of Oslo to continue support data use, data analysis, because our planning relies on data. And you know, we have this Health Intelligence Center, so we really need University of Oslo and other partners to come in through this hub to support our data. Coming to Finland, we have a strong partnership around education. We have the HEPTED project. We have a huge project around early childhood development. We have a project aiming at training teachers, and all these are connected to health in any ways. So if health is not a top priority, as part of our MOUs with the Minister of Foreign Affairs, we've found a way to include health from all these Nordic countries through the hub. To Denmark, there is a lot going on. I know World Diabetes Foundation and Rwanda Nordic support Rwanda Biomedical Center and the government of Rwanda when it comes to diabetes in childhood. We are provided free insulin and also capacity building, but we want to do more. We don't want to take care of children without taking care of their mothers. So I think this hub can do more, building on existing partnerships. We also have a good collaboration with Ferring Pharmaceuticals. They manufacture a very efficient drug. It's the carbetocin that prevents postpartum hemorrhage. And you all know that postpartum hemorrhage is the first killer in the maternal health. But Rwanda, by using drones, has managed, drones to deliver drugs and vaccines, we've managed to drop down the maternal mortality due to postpartum hemorrhage. But we discussed during the summit in Sweden, we discussed with the French Pharmaceuticals, and with the support of the Rwanda Medical Supply and the Rwandan Minister of Health, we committed as a country to expand the use of carbetocin to more women. Because we started with the pilot project, we are a country that likes to prove a concept before expanding to a large scale. So we committed that by Feb, we'll have all our women covered by these amazing drugs, that is carbetocin. Coming to Sweden, 14 universities supporting Rwanda through research and education. But some of these universities focus on health. I will mention Karolinska Institute. You have a good partnership when it comes to training in clinical trials. We have Martina Hospital that was mentioned that supports the 4x4 strategy. But we also have IVI, the International Vaccine Institute. The European office is located in Sweden, and the African regional office is here in Rwanda. So there is a strong connection. And many other examples. I just wanted to inform you about the summit and to tell you that together with the University of Rwanda, University of Global Health Equity, and the Aarhus University, and Ines Ruhengeri, we are going to start working on concrete actions. The next summit is not going to be about literature, problems. We'll connect with the concrete actions, focusing on the main threat we have that are NCDs. And Mr. Zaman, you said you invest in IT, artificial intelligence, and when I brought health to you, you said, this is not my field. We all need health. And Rwanda has committed to start reinforcing use of artificial intelligence and technology. So you like it or not, I will come back to you. You have to invest in health in Rwanda. And thank you to our panelists. Thank you to all the participants. And I hope we'll have time. I think we saved 10 minutes. I think the MC can allow some contributions from the audience. Thank you so much to our brilliant panelists.
Thank you.
A big thank you to our panelists for that very perspective conversation. And we do have time for a few inputs from the audience. So if anybody would like to add something, please put your hand up and a microphone will be delivered to you. Okay, I guess we are all very satisfied with what our panelists and Her Excellency Diane shared with us today. And so, on that note, we are going to move to our next segment, which is a presentation, and it's titled Successful Partnerships in Practice, Health Tech Knowledge Bridge. And I would like to introduce the session and the speakers, I would like to invite Ms. Maria Salin from Chalmers University of Technology. Maria, you're welcome.
Let's see. Thank you for having us. And Diane, it's been amazing so far. Dear ambassadors, ministers, and all the participants, it's kind of nervous to be here, but it's really nice. I represent Chalmers University, and I want to start with this picture. So, Health Tech Knowledge Bridge, this is what we do. I will go back and show you what Chalmers is, and then we want to be really concrete. As a lot of the words I will be using, we've heard them many times. It's to be concrete, to make some action, and health tech, there's a gravity to Rwanda, and then from here and out. And of course, this is what Chalmers wants to add to. My name is Maria Salin, and I've done this presentation with Peace, my colleague who's in the back, and I will later on hand over to Mikael and Jean-Baptiste, who will give you a very concrete example of what they are working with. I like this picture. It's the vice president of Chalmers, Mats, who was on stage yesterday, talking to Principal Ignas from the College of Science and Technology, Torbjörn from Chalmers, and Pascal, who is the director of the Unipod Rwanda at the Technical University. If you haven't been there, there will be an open house tomorrow between 2 and 4. It's a beautiful view, wonderful coffee, and it's a good place to meet and talk, and this is what the Health Tech Bridge is about. So this is from November last year when we were here. So I represent Chalmers. It's a technical university. We do research, education, and outreach. There's students in engineering, architecture, and naval. We are focusing a lot about entrepreneurship, and I think this is where it fits very well with what's going on in Rwanda. So we do research and education and also a lot of practice in entrepreneurship. We have a strong connection to the surrounding society, and we want to make an impact, and this is what we want to do here as well, right? So this is what Chalmers, as a more practical university, even though we do basic research as well, we want to be part of this. We have a lot of students and employees, and what's different with Chalmers compared to many other universities in Sweden is that we are a foundation university. So we're owned by a private foundation, which means it gives us a bit more flexibility to do what we find interesting and what we need to do. And also mention that we have some areas of advance, which are collaborative spaces to do cross-disciplinary research. And this is important for what we do here. It's not just one topic. It is this mixing of people, mixing of places, and mixing of knowledges that make magic happen. So going back to what has Chalmers done in Rwanda, and we've been here about 6-7 years. It started with the SIDA bilateral program that Sweden has done for 20 years, but Chalmers has been on the last program. That focused more on energy and innovation. And in this work, we established an innovation hub, which is still ongoing, and it's very successful. And Pascal, who was on the first picture, is running this together with his team at the Technical University. They later on got funding from UNDP to build and be part of this Unipod, which is kind of the physical place, the heart of what Chalmers is doing here in Rwanda. A place to meet, which is very nice. We have gathered 11 universities from East Africa for workshops. It was called SWEFUN. It was funded by the Swedish government. So there was a nice place for different universities in Eastern Africa to meet. And as I said, Chalmers being a foundation university, it's a little bit flexible. We can do things that are what the university wants to do. So there's been funding from our president to keep working with the collaborations with UR. And coming back to why I'm here with the Health Tech Bridge, it started after a trip in November when the Chalmers management came down for an innovation week. They also met with Business Sweden event, and there was Norrsken had an event, and they realized that what we're doing in energy and in innovation, there's so much about health tech. Chalmers also have health tech. Let's do something about that. So there was a grant by, let's see if I can move on. Oh, it's a little bit slow. There we go. By the Chalmers president to keep adding the Health Tech Bridge to what's already ongoing. So what the Health Tech Knowledge Bridge that I work with, what it is, it's a collaborative platform. So it's designed to connect Rwanda and Sweden to facilitate collaborations in the health tech sector. And we've had 2 visits so far. There's a lot of people on this picture. Some of them in the audience now, and I'm very happy that we were at this Unipod, and we had Karin Teg-Markvisell, the ambassador of global health from Sweden. She went on a tour, and we talked about how innovation, student work, how that actually has a big impact of the healthcare. But to zoom in a little bit on the people who are the ones driving, we have Mats, who was on the stage yesterday. Helene, the leader of the Chalmers Rwanda initiative, she's sitting in the audience here. Peace, my colleague, who is the sort of, I am on the Swedish side, and Peace is on the Rwandan side, running this bridge, or creating what it is. Pascal, working at the Unipod, it's me, and then Principal Abraham. Last time we were here, we had a really nice meeting with Abraham, and he appointed 2 people to be the contact people for us, just to have, who do we talk to first to create this bridge so we have a good flow of people. So I'm very grateful for that. Thank you. Why does this matter? And I mean, most of you know, and we've touched upon this many times, but we want to exchange talent and expertise. So this is where we focus the most, to have student programs, research collaborations, and professional exchange. We want to translate the data into solutions, and this is something where Chalmers is really good, and we want to add more. And SIDA has so much data, there's so much knowledge out there, but how do we make this into impact? And we also want to ensure long-term reciprocity. We need to give back to those who've been kind of observed, give back. What can we do? What impact can we do to make a change? In the long term, we want to open new markets and create jobs. This is what yesterday was a lot about, and I think Chalmers can facilitate that by probably giving knowledge to Rwandan students and the people beyond. And of course, we're building on the 20 years of Rwanda-Sweden collaboration that SIDA has started. Here's an overall picture of the framework. It's very detailed, but just to we have made a framework of how we want to work. With Sweden, Rwanda, we have the hospitals and academia, we have public sector, but also the private sector, and we'll work with student exchange and many things. But this is the vision. And I want to be concrete, and Diane has been pushing. We need to be concrete and make actions. So what we are doing right now, that was a vision. What's ongoing at Chalmers and Rwanda in the collaboration? We have research right now, and I'm very happy Marina Axelsson Fisk is a professor in mathematics, sitting over there. She yesterday met with a PhD student that she will supervise, together with Eric Remera from the RBC. So this will be really good. And it's titled Robust Policies, Learning for Adaptive Public Health Intelligence in Rwanda. Pretty spot on many of the things that's been touched upon before. So I'm hoping this is the start of many more projects to come. In AI, we have Filippa Tsigas, who is a professor in computer science at Chalmers, and he's been working for many years, 6 or 7 years in Rwanda, together with the Center of Excellence IoT. And he has a PhD student working on AI and predictive models for malaria outbreaks. And he's also kind of supporting the whole Center of Excellence on how to build a good academic environment. How do you do with seminar series? How do you help each other to build and be stronger researchers? And we will do some co-application for funding to strengthen the innovation and the grant writing capabilities at UR, CST, and CMHS. And this is, of course, beneficial for Chalmers in many ways, too. Then we have student exchange. And in the room here today, we have 6 master students from Chalmers. I'm very happy to have them here. There are 2 girls working on AI-enabled national cleft registry and a digital speech follow-up in Rwanda. And they will work with Professor Faustin, and they have a Swedish company that's working with AI and health that is providing the technical supports. Elvira and Victoria will be hopefully out by the coffee with a little poster looking like this, so you should ask them more about what they will do when they're here for another couple of weeks. I'm not going to go through it, it's a teaser. The poster will be out there. And then we have another research project that we called Stroke Detection Helmet. And this is an ongoing health technology assessment. We're on the 2nd round of master students. There was 1 student, Hassan, who finished in the fall, and now we have 4 master students, David, Hannes, and Andre, sitting over here. Talk to them more. But before you can talk to them, I would like to have Mikael and Jean-Baptiste, who are the professors and the researchers behind this work, to do a deep dive into what is the stroke helmet and what are we doing in Rwanda and how is it going. Please.
Yeah, so Jean-Baptiste and I will tell you together a little bit about our collaborative effort on this stroke helmet. I was asked to join this effort of the Knowledge Bridge only a few years ago, and I was a little bit reluctant, I would say, because I've been in the innovation system for the good part of 20-30 years now, and I'm sort of semi-retired already, so I thought if I'm going to do something in Rwanda, it has to be something very concrete and very down to earth. And I said, if I can do this, my pet project, which is this stroke detection device, I'm happy to do that. And we started out than working on this project together with University of Rwanda. And just a few words about the background to this project. And first the outline, and talk a little bit about why this is important for Rwanda, and then talk a little bit about the technology, and then Jean-Baptiste and I will say a little bit about the status of the project. So most of you have probably seen this project where the non-communicable diseases are overtaking the communicable diseases in Rwanda, and how this is related to the improved life expectancy that we've heard about during this conference already. And of course, stroke being a lifestyle-dependent disease, the increased and the age-dependent disease, the improved lifestyle in the improved life expectancy is going to be challenging for Rwanda, and is already challenging, as it is for all of Africa, as there is an expected increase in the number of strokes over the next 5 years of roughly 20%. Now, on the global scale, there are about 50 million traumatic brain injuries each year. The prevalence that is the number of people affected at a given time, is around 160 million. 80% of these occur in low and middle income countries. And the global cost has been estimated to be about 400 million. This is for traumatic brain injuries. The incidence of stroke is very similar. There are about 50 million stroke cases a year. A third of these die immediately. And it's a very, after heart attack is the most common cause of death. And 50% of the people affected are chronically disabled. And at the given time, there are about 100 million people globally who are affected by stroke. Now, 70% of all strokes and 87% of the disabilities occurs in low and middle income countries. So it's highly relevant for Africa and for Rwanda to take this very seriously, as I do know that Rwanda is doing. It's interesting to look a little bit of the incidence rates. And then coming from Sweden, it's natural to sort of compare Sweden and Africa and Rwanda. And you see from these incidence rates on the slide here, you see that they are not that dissimilar, which at the first glance you might think that's not very alarming, but then you have to take into account a rapidly increasing rate of strokes in Africa and a decreasing rate of strokes in, for instance, Sweden. And also you have to take into the account that Rwanda has a very young population, and that is growing older. So the trends are in different directions, so to say, between Sweden and Rwanda. And then this is further stressed when you look at the mean age of the onset of strokes, where you see in Sweden that is 75 years, while in Africa it's 57, and in Rwanda around 60 years old. So this is also a signal to take this very seriously. The other thing is to look at the stroke care, and the time, since time is brain, as they say in the stroke area, lots of brain cells die every minute after stroke onset, so you have to be very quick in diagnostics and treatment. And you can look upon the time to get to the right hospitals, and you can see that there are challenges in this area as well, both in Sweden and Rwanda, and in Africa in general. And then you come to the most serious part of stroke care, which is most of the strokes that occur are ischemic strokes, blood clots in the brain. And in those cases, reperfusion is very important treatment. It's either through thrombolytic treatment, where you give a clot-resolving drug, or through thrombectomy, where you mechanically remove the big thrombosis in the large vessels in the brain. And that is only starting in Rwanda, and that has got to change rapidly over the next decade or so. Now, the technology that I have with me here today You can open it. It's a stroke device that's not going to solve the challenge of stroke anywhere in the world. It will help speed up the diagnostics and triage to get the patients to the hospital earlier. But the real challenge of stroke is, of course, the fact that it's a lifestyle and health preventative challenge that needs to be addressed to solve this global stroke problem. But at least this type of technology can alleviate some of the challenges by getting to early treatment earlier. And this is a microwave-based device which is working pretty much like in a CT, but with microwave, so it's completely harmless. You do the analysis in 2 minutes. You don't need much training to use it. And it comes in a backpack, as you see here, and it's battery-driven and AI-based. So you basically get, within a minute or two, you actually get the device to tell you whether it's a stroke or no stroke. I'm happy to demonstrate this for you if you're interested in the coffee break or so. I'm not allowed to do any measurements, but we can show you how it works. Anyway, so it works by you sending the microwaves through the brain. And you could actually do microwave imaging of this. It will be very slow and would have been of no use for acute stroke care. But what you do instead is that you actually collect the data from all this microwave that goes through the head, and then you train a deep learning AI-based algorithm to actually recognize stroke patients. So that's how you actually get to the stroke. And this has then been evaluated both in hospitals, in ambulances, and in ambulance helicopters in 5 different countries around the world. And now we're doing now a project in South Africa and in Rwanda to actually try to see if this could be of health benefit in these healthcare systems. Now, this just a little bit about the status of the project. Maria has already given a little bit of the background to this project, and I'm not going to repeat it, but this is a fairly young project, as you see. I got involved earlier last year, so we had the first master student here later in that year. University of Rwanda and Chalmers have signed a collaboration agreement around then. And the first master student was then that did this work with supervision from University of Rwanda and King Faisal Hospital. And then in November 2025, we had a planning meeting here in Kigali, planning for the future of this project. And then we actually got John Baptiste to get involved in the project, and we're very happy to collaborate with him and his team. So maybe you can say something about the present status of the work that you're doing with the master students. And
Thank you, Michael. As you said, we met in November 2025, and we discussed how we can partner to move this health technology forward. And since then, we agreed to have students conduct feasibility for clinical trials, but also for market access to introduce the device in the Rwandan healthcare system. So we are still at the initial phase. I have 4 students from Chalmers. 2 of them are conducting a study on clinical trial feasibility, and 2 others are conducting a study on assessing the market access and implementation. And we'll be guided by the data from those 2 assessments to plan for proper clinical trials, but also to start building the business case to introduce this element in the healthcare system. So from tomorrow, the team will be meeting major stakeholders in this field of stroke and brain injury. And we hopefully in the next summit, we will present the progress. Thank you.
Thank you very much for that presentation. And as we proceed, I would like to mention that the Nordics and Baltics have such a special approach to international education, research, development, and innovation. And we have a lot of panels that are going to be exploring that today. But I would like to invite Miss Simona, an EU twinning project expert, and followed by adjunct Prof. Sai Väyrynen from the University of Helsinki to come and give us a presentation where they will share their experience about international cooperation and networking strategies. You're welcome.
So, good morning to everyone in this room today. My name is Simona Mikaliūnienė, and I'm going to talk today about international institutional partnerships in the frame of EU twinning tool, and I will be also briefing you to some, I would say, very practical insights about how to approach Rwandan partners, Rwandan stakeholders, and how to work with them on the joint agendas together. I will start my presentation with a very brief overview about what does twinning as a tool is. So it's basically EU assistance delivery tool to institutional capacity building and reforms that are happening within public administration. And this is a tool for peer-to-peer cooperation between public administrations in EU member states and partnering countries. Twinning projects are built on partnership-based cooperation and on joint ownership, where European Union member states and the public sector experts from those countries are working hand in hand together with officials from the beneficiary country, which is in our case Rwanda. And they work together on the very concrete and defined mandatory results that are being defined by the twinning project. So normally twinning projects, they are composed in components and different activities that are corresponding to the results of the project. And activities include different type of interaction. So it's like workshops, training sessions, expert missions, study visits to EU member states, and so on and so forth. And normally twinning projects, they last from 12 to 36 months. And if we look back historically, the EU twinning has been as a measure to support EU enlargement for the new countries in Europe to join the European Union. But then from 2020s and onwards, it has become a global instrument offering countries an equal partnership and partnership-based approach. And twinning as a program falls under the Global Gateway Program or the strategy, which boosts and supports education and health and research systems worldwide. So in that very practical case, I wanted to present you the twinning project that is now being launched between Rwanda, Lithuania, Finland, and definitely EU delegation here in the country. I'm very happy to be here today because this project is a really nice example of this Nordic, Baltic, and Rwandan cooperation. So the main aim, the overall aim of this project is to really strengthen pre-primary education here in Rwanda and to work together to enhance learning outcomes at the foundational level, and definitely work on the enhancement and improvement of how to engage parents and wider community, so all the people that are around the child, to really support his or her early learning so kids would gain the right skills to enter the school at the right age. So in this consortium, in this cooperation, we work hand in hand with the Ministry of Education of Rwanda. And from Lithuania's side, we have the Ministry of Education, Science and Sports. Also, there are another partnering institutions as European Social Fund Agency in Lithuania and the National Agency for Education. But we also have a Finnish partner in this consortium, which is in our case, Hammer University of Applied Sciences. So I'm very happy to know that there are colleagues in this room today who are working on this initiative and supporting this initiative. And in the case of organizations or institutions here in Rwanda, yes, I mentioned that we work with the Ministry of Education here, but also with the affiliated agencies that are at some point helping to strengthen pre-primary education here. So it's basically Rwanda Basic Education Board, it's the National School Inspection Authority, and we also work very closely with the National Child Development Agency, which falls under the Ministry of Gender and Family Promotion. So these are the main things to mention around this project. We are going to look at this project through 4 different angles. So first of all is the expansion of early childhood education services, as we see and we feel and we realize that there's a great demand, huge need for kids to have a place where to learn, where to start their learning journey. We will also looking at the curriculum for pre-primary education, to the teacher training and the quality of it as it comes on the play-based approach and the learning through play for the little ones. We will also looking at the quality assurance and the very, very practical tools for the classrooms on how to observe the learning and teaching process as it comes to pre-primary settings here in the country. And as I mentioned already, we are also working on the parental and community engagement of how to support early learning, early reading, and so on and so forth. So this is a very, very brief overview about our project, which illustrates the twinning in a very practical way. But I really would like to say a couple of, share probably a couple of insights, the practical ones from my experience living here in Kigali now for the 5th month and being the resident twinning advisor for this project. I was asked to talk about what are the not the recipes, but maybe the advices of how to approach Rwandan stakeholders and Rwandan partners as it comes to the international or institutional partnership. So I really would like to emphasize a couple of things and to give a gentle reminder to all of us in this room. So first of all, when we are talking about the partnerships here in this country, in this region, we really have to not to forget about the overall context. We really have to focus on long-term reform impact and to really understand what is the existing context. So this thing to have in mind. Preparing for this presentation, I spoke with quite a few people. All of them were Rwandese. I spoke with pre-primary teacher, I spoke with colleagues at the Ministry of Education, I spoke with a therapist, pre-primary teacher, with the businessmen over here, and actually asking them what could be the interest of Rwandan partners to start a joint agenda or joint initiative or joint program was actually people were just mentioning that you really have to focus on the initiative or on the program that would really serve the wider public. So I think it really nicely illustrates this way of living and being here in Rwanda that is very much community-driven, very much community-based thinking and just being. When you are on your way with your partnerships, I think the guiding stars must be the ongoing and very open dialogue. Because Rwanda is a state which is developing and improving, and this is the state where the progress is very rapid and the changes are very, very quick. So you really have to be both practical and very flexible, because the things that you have defined or agreed on a year ago, they do not necessarily, they might be already in place when you approach the implementation phase of your project. So really have this in mind and listen more than you speak when you work with people over here. The last point to mention, I think it's kind of a crystal clear as we enter different kind of partnership or different kind of cooperation. But however, I think it's really worth reminding ourselves that co-creation and not the prescription should take over. I recently listened to presentation of Professor Hasina Ibrahim from South Africa University, and she was talking to the audience. She was using very, very wise and very mature question to the people in that room. She was asking that if you would have a box of future of your children, whom would you allow to fill that box in for you? So I think this as I said, very wise question really reminds us that working with people, with local systems, it really means that we interact with indigenous values and local reality. So asking my colleagues at the ministry about what are the major pitfalls when the foreign partners approach them and start some work together, they say, you know, this people, they just really want to impose their own agenda. So even though we understand that this should be like two-way street, we really have to remind ourselves that one size does not fit all. And final part of my speech today is really going to be about the culture, because even though this is about institutions and this is about countries and development of different systems and frameworks, there are people all over. And institutions are communities. So I really encourage myself being responsible for that project that I just mentioned, but also for all of us to really, when rushing through project activities and deliverables, please let us do not miss the chance to reflect on the culture and the people that we work together. I think this is very, very important to have in mind. And you probably are very much aware about this Ubuntu philosophy, which is originally from more of like from South Africa, but still this philosophy of feeling yourself and being here through the others, through the people that are around you, this sense of togetherness, connectedness, and unity. I think it's really, really important, important value to carry in our hearts and in our mind when we are working together. We had a wonderful opportunity to observe teacher training at the teacher training college here in Nyamata. and the teacher trainer, the tutor, who was a young man giving the lesson, the lecture to the future pre-primary teachers, while conducting that lesson, he was like constantly checking with that young audience, are we together? Are you together? Are we still on the same boat as it comes to those topics that were discussed on that lesson? So I think it really shows this huge importance of people, of just being together, living together, and definitely working together. So keeping those partnerships alive, talking with people are really the key drivers for us to really succeed in our partnerships. And yes, making connections, talking with people, building trust, I think these are still the key values to have in mind. That's it. Thank you very much.
Thank you very much for the wonderful presentation. Please, Dr. Sai, Prof. Sai.
Good morning, everybody. I'm going to make an exception. I'm a teacher. Usually I have some slides to show you, but today I'm just going to talk. My name is Sai Väyrynen, and I'm from the University of Helsinki in Finland. But I have been working on this continent more than 30 years. So I'm going to talk in a very practical terms about my personal experience in collaboration in education sector, but in particular in higher education, from collaboration between the universities and multi-institution collaboration as well. Ambassador Diane was saying that health is a priority. I agree with that, but I also said that education is a priority, because if we don't have the health and education to train, to educate all those people that we need to do all these fancy things and to come up with the innovations, it's not going to work out. So education is also very important. I'm also talking from my perspective as an academic, fully employed with a full teaching and research duties in my home institution, and looking from that perspective of the collaboration that we are doing here now, in particular in Rwanda. And my colleague earlier shared her experiences, ideas about the collaboration, and what I have understood is that the most important investment is on time. You need time to do all that things. I know that in the business world, it's not so perhaps so important, but we know that education systems don't change overnight. Education practices don't change over time. Technology doesn't change education just overnight. It all takes time, because education starts from the heart and from the brain and from the practice. And we all have experience. I mean, as a teacher, we all have experience of education, our past experiences, and we are ingrained with that experience. And to change one's own behavior takes time. I'm sure we all have experiences of that when we try to learn something, new ways of behaving or doing things. It will take time. And when we take that to the scale, to the education systems, it will just take time. So that's that would be my first kind of item. Invest some time, because if you rush, you don't get there. And we need the time to build on those aspects that were mentioned earlier. We need to get to know each other, not as institutions, because although institutions are communities, but communities are made of people. So we need to get to know each other, to build the trust, to understand what we mean and to understand the context where we are working. And when we initiated the collaboration here in Rwanda, we were 4 higher education institutions in Finland and 2 here in Rwanda. But the very important aspect in our collaboration and getting to know each other and understanding where we are, where we are going, and whether and what is there common to us was the role of the diaspora in Finland. So I mentioned Hills Connect because they have been very instrumental in their role as mediating between the Rwandans and the Finns, doing the interpretation. Okay, the Rwandans say this, so they mean that. And when the Finns are saying something, the Finns said this, but this is what they mean. So sometimes we need these, like a cultural interpreters to get us further on. So TAP, I would, for the European colleagues here, for the Nordic colleagues here, I would say tap on the knowledge and experience of the diaspora in your countries. That will be very, very useful. In terms of working together, well, maybe investing on time as well, because we all need resources to work together. We need time. And that's very, very difficult because we all don't have the time because we have all other duties. But also we need time to create the resources, whether it's a funding applications, whether it's doing some kind of other kind of fundraising. But that requires a time, and it's very frustrating. And that's something that sometimes I feel that our systems and frameworks and all those that we are using to get the resources, they kind of ignore the time factor. I'm sure you have all experienced that. But I wanted to be very frank because it's a part of the collaboration, and it's also something I think it is important that what we are doing, but it's important that we also understand the process that we are going through. Okay, in our collaboration, of course, we have to be very rigorous. We have to follow the rules and the regulations of the funding mechanisms and so on. But we also have to be flexible because if we are only rigorous, then we are going to hit the wall at some point. So we have to kind of maneuver the process all the time. But we have to also remain focused. What is it that what we are doing? What is our common aim? What is it that we all get as a partners from this collaboration? Because if we feel that this is not meaningful, then we will end up into troubles. And sometimes the projects are very, very cumbersome. It's really nice to listen to all the projects here because they sound that they are all kind of going on very well. And we know that in practice, there are lots of things that we need to take into the consideration, and that also takes time, and we have to sort out those things. But I think it is a part of the development and the co-creation that we solve the problems as they come. But also very important in our collaboration is that have fun, because this is why we are doing this thing. We want to build a better world, but we also want to enjoy the togetherness, the co-creation, new revelations, new ideas, new understanding, a better vision for the future. And that's fun. And if we lose that, we will end up into trouble. I was also asked to talk about some of the EU frameworks that are available for higher education collaboration, so my focus is on those. I think that EU in general has a very kind of a good set of frameworks for higher education collaboration. There are separate frameworks for research, there are frameworks for mobility, capacity building, and all kinds of innovations and developments. For example, mobility frameworks are, I think, particularly important in providing an insight to different teaching, learning, research, and study cultures. And through those mobilities, we can also build that very important understanding within our collaboration that will result in continuing the collaboration and widening it and deepening and really understanding what is going on. I was in October last year, I had an opportunity to do 2 weeks teacher mobility at the College of Education at the University of Rwanda, and I was teaching at the main campus in Rukara. And it's quite different context compared to this lush and very green and very well infrastructured capital. So I think it gave me an insight to the reality of the students and my colleagues, lecturers who are working in the campus there. So those insights are very, very important, and we need mobility for that. Currently, we also have one PhD researcher from the College of Education in my institution at the University of Helsinki, doing her student mobility there. So these are wonderful opportunities, but there is always the but. I think, again, what kind of sometimes makes the collaboration very stressful is that the application procedures are very heavy. There is an intensive competition within the EU for the funding, and it seems over the past couple of years that the competition is getting harder. So you need almost 100 out of 100 points to get funding, and it is something that I don't know how to solve that. I think somebody else needs to think about that. But it is very stressful for all institutions really to try to build solid applications. There are so many good things and initiatives being proposed, and only very, very small fraction is being funded. And again, the building a solid application takes time. For the past year and a half, we have been writing an application for Erasmus Plus capacity building in higher education funding, and involving 2 universities in Mozambique and 2 here in Rwanda, and 2 in Finland, 1 in Portugal. And it has been taking a lot of time. You spent 1 year and a half in getting people together, discussing, trying to make a common understanding of what is it that we will propose, what is it we need to do. And you might just end up wasting that time because the competition is so vigorous. Another interesting discussion, and I think this is especially for the European partners, a discussion that has been going on for some time now, but it is coming up particularly in higher education and global and higher education internationalization research, it's the issue of decolonization. And particular African scholars are reminding, not only reminding us, but are urging us as European scholars and particularly also decision makers to really look at the way in which we frame our mechanisms, the way in which we formulate the funding calls and so on. And for example, looking at, for example, Erasmus funding scheme, there is a lot of emphasis on promoting EU values. But our scholars in the Global South are asking, what about African values? What is their role in the collaboration? And I think that's something that we have to be very conscious about. We have to do something about it. And I think we really have to think about what does it mean when we talk about reciprocal collaboration, when we talk about respectful partnerships. We have to, as Europeans, we have to value and show respect to the values of the communities and societies of our collaborators. And thinking about this world at the moment, I think co-creation, which was also mentioned, is the way forward. But we can't co-create if we can't talk and understand our different worldviews and find a way to work with the different worldviews and take the common elements from those worldviews to guide our work. So I will finish my talk to a little bit critical note, but I think this is something that we have to take as a homework as a Europeans. Thank you very much.
Thank you very much, Professor Sai, for that insightful presentation. And we will be going to our break now, but before our coffee break, if we could all move to the front for a quick group picture, starting with the people sitting on the front tables, just a little quickly for a picture. And our coffee break is going to be 15 minutes sharp, so let's all be back at 16 minutes past 11. But Your Excellencies, Honorables, please, if you could move to the front for a quick group picture. Thank you very much. And everyone as well from the larger group of the audience, please come to the front for a picture. If we could please get in place for the picture, let us get in place for the picture so that we can then go for our coffees quickly. Ladies and gentlemen, let's get in place for the picture. Could we please move at a faster pace so that we can get in place for the picture? And everyone else could come then to stand behind the line of chairs that are aligned at the front. Let us try to move at a quicker pace so that we can go for our coffee break soon and also have time for networking as well. We could stand behind the line of chairs that are aligned at the front. Thank you everyone for your cooperation. Let us have a quick break and be back in 11 minutes. Thank you.
I will
I want this background. Eh? I want this background. One more. No, it's okay. I was just checking if the thing has gone off. Finished? Finished? Excuse me. Hello? 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 Eh.
Ladies and gentlemen, let's start getting back into our seats so that we can continue with our program of the day. Could everyone please still outside of the room to start coming in so that we can continue? In the spirit of keeping on time today, could we please start getting back in our seats? And if you're outside of the room, could you please come back? Could we please start coming back into the room and getting back into our seats? We will have much more time to network in the afternoon as well. Could we please walk back into the room? Ladies and gentlemen, could we please get back inside into the... Could everyone please get back into the room so that we can continue with our program of the day? Could everyone please, who is still outside of the room, get back so that we can continue with the program of the day? Let us please get back into our seats. Could everyone get back to their seats, please? Could everyone in the room get back into their seats, please? And everyone who is still outside of the room, could you come back, please, to the room? Could everyone please quickly get back into their seats so that we may continue with the program of the day, ladies and gentlemen? If we could please move at a faster pace in the spirit of keeping on time. Thank you, everyone, for your kind cooperation. We will now continue with our program of the day, and our next segment is going to be a panel discussion, and it is titled Building Africa's Biomanufacturing Vaccine Innovation Ecosystem, Vaccines, Pharma, and Emergency Preparedness. This is a panel discussion that is going to be moderated by Dr. Ismail Abiola Adebayo. Mr. Ismail, please proceed to the front. And the panelists at this panel discussion are going to be Prof. Leon Mutesa, the director of the Center for Human Genetics at the College of Medicine and Health Sciences in the University of Rwanda. Welcome, Mr. Leon. And the next panelist at this panel discussion is going to be Dr. Chris Kyriakidis. I'm sorry for the pronunciation of your name. He is a CEO at G-Men Delmore Ibrahim and also at IVS Health. And I'm going to invite also Dr. Albert Tuishimge from the Ministry of Health. Thank you, everyone. If we could please give a round of applause for our panelists. And up to you, Mr. Ismail.
Thank you very much, the MC of today, and I welcome you all to this very interesting session. And with me here, I have very great personalities who are very relevant and have done tremendous work on the subject matter that we are going to be discussing in this panel. So allow me to introduce them again briefly and what they have accomplished and what they have done. With me, I have Professor Leon Mutesa, the Professor of Human Genetics and Genomics, and is the principal investigator of a very big and relevant project, Math Plus, which was launched about 2 years ago. Then with me here I have Dr. Chris, you are welcome, the CEO of G-Mendel, I believe, a very innovative company that is very relevant and works on early diagnosis of genetic conditions in newborn. Then I have Dr. Albert with me here, who represents the government. He is from the Ministry of Health and an expert in HIV research, I believe. Then here I have Dr. Mo Ibrahim. You are highly welcome. He has a very important startup known as IFS, who is trying to find common solution to different voids in medical drugs and delivery across the world. So I welcome you all once again to this interesting panel, and I believe we are going to have a very fruitful discussion. So as we all know, this panel is about, we want to have an interaction on a very important topic for Africa in general and for Rwanda in particular, and that has to do with how we can improve the ecosystem on large-scale production of vaccine and also by manufacturing of pharma products. So without further ado, I would like to start my interaction with Prof. Leon Mutesa. And I would like to ask him to enlighten us on a very important question, which is about, we know Africa as a continent, we are lacking human capital and capacity, human infrastructure. And this is very important thing that is needed if we are going to scale up for production of vaccine and biopharma products in a large-scale level. So I would like to ask him that under his project, Math Plus project, what are the positive impact this program can bring to uplift and improve the current situation we have in order to have this final dream of having a large-scale production of vaccine and biopharmaceutical products in Africa.
Thank you very much, moderator. Good morning, everyone. So, this is a very important equation, actually. There's a lesson learned during the last 4-5 years during the COVID time when we have seen most of the countries were struggling, actually, to have access to different biotechnology solutions, but also we came to face challenges when it comes just to vaccination of the population. And Rwanda was also part of the country struggling to get this. So that's when we also had some ideas to have some homegrown solutions, how we can be self-reliant, self-independent in terms of the solution we propose, and also to tackle some of the issues like the outbreaks, but also the vaccine. So despite the significant progress on the continent and also the aim to reach at least 60% by 2040, which is just a CDC, Africa CDC goal, and also African Union goal, we still see that Africa is still relying on importing just vaccine at more than 99%. Only 1% of vaccine can be produced today on the continent, which is a very big gap. So why? Because even that 1%, we don't have, it's more on fill and finish, and we don't have this from end to end, the full spectrum from vaccine production up to vaccine clinical trial and also on the market. So we still have that gap. So of course, some of the lessons learned just were some of the motivators, also the drivers for us to design this kind of project, MAVPRAS. Actually, MAVPRAS stands for Manufacturing Access to Vaccine, which is just an initiative from Team Europe initiative, a program It's a European program, which just was created just to support countries, including Rwanda and low-income countries, just to be able to have this kind of vaccine by manufacturing, but also other programs like cold chain, supply chain, but also other programs like a regulation process. So specifically for this program we have at the University of Rwanda, we have been trying just to be more focused in terms of what we need, what are the missing gaps. So the gaps, as you mentioned, clearly mentioned, the first one gap, major gap is human capital. Number two is just the R&D infrastructure, and also the clinical trial capacity. So when it comes just to human capital, so we try to see where we have different gaps in terms of skills that we need on the continent. And then this program is just supporting creation of new 11 master's and PhD program in different aspects for supporting the vaccine by manufacturing, clinical trial, infectious disease, experimental medicine, which is just the use of animal models, which is also part of the vaccine by manufacturing. Because when you develop the vaccine, from development up to the market, you need just to pass through the different clinical trial process. So we designed those programs, just to name a few of them, just to be sure that at least Africa, Rwanda, can just start just producing this vaccine, but also having enough skill set. So this is really the first huge gap that we have, and we are trying just to address with this project. Number two, so we used just to train at the University of Rwanda, but also other universities within the country, but also in the continent. Scientists, the brilliant scientists. We have a very good, brilliant medical doctors, scientists on the continent, but trained abroad. And then we have been experiencing this kind of brain drain. So one of the target of this program is also to create some of the environment and also the possibility to return the scientists, but also to attract those who are being trained abroad to come just to Rwanda, but also where we have the ecosystem. So I can give you an example. So you know, today in Rwanda we have the ecosystem for vaccine manufacturing, which is being supported by the leadership. So we have the big company, like biotechnology companies. Biotech is one of the big companies. But also when it comes just to vaccine safety and the testing, we have International Vaccine Institute, headquartered here for Africa Region Office. And also, we have the African Medicine Agency, also headquartered in Rwanda. So when you see there's a full set for the ecosystem. So where we have the gap again is just the human capital, the skills. So our project is more just focusing on development of skills in this regard. And again, this morning we had just to chance to understand what is the 4x4 reform, government reform, which is just a very ambitious program to have 4 times the professionals we have today within the next 4 years. So our MAV Plus program is also contributing to this reform. And then we start with just a very good number of scientists to be supported by this program, more than 150. But we expect within the next 4 years, at least to have 4 times this number, and even more. So because this is just in regard to the capacity we got from this program, but this project that is supporting the ecosystem is also available for all African scientists on the continent. And the lastly, clinical trial. It's also one of the gaps we have. At least 2%, only 2% of clinical trial from phase 1 to phase 4 are being done in Africa. So you see, we are just missing the opportunity to conduct end-to-end the clinical trials. So MAVPRAS is also targeting to increase this skill set for clinical trials. I mentioned the preclinical trials, just the phase before the clinical trial, the human use of the products, medicine or the drugs or vaccines, but you need to test this before in animal models. So one of the strategies we are trying to have with other co-funding mechanisms, not only from this EU MAV+ program, is just to see where we can partner with different programs, even in the Nordic countries, where they have this facility for the animal models, and also to support the clinical trial, preclinical trial capacity in Africa. Actually, the preclinical trial in Africa, there are few countries with the facilities in Africa, no more than 2 countries able to do preclinical trial study in Africa. So you see, this is a very huge gap. But last but not least is just the regulatory process, which is not part of the MAV+, but some of the scientists we train in this, they will also, from one to one, just interact with the regulatory process in the country. Because when we train the clinical trials specialists, we also want them just to understand the regulatory process. And then, as I mentioned, the ecosystem is really active here in Rwanda. So I can just mention that Rwanda has been reaching the maturity level 3, which means the WHO maturity level 3, it's just the ability to regulate the product, the medicine product with the international standards from the WHO. Thank you very much.
Thank you very much. That is very thoughtful and well detailed about what the work you're doing, and it's well appreciated. And I think with this much of work, very direct, very straightforward, and there's going to be a lot of improvement in very soon, and we're going to have a better ecosystem for vaccine production in Africa. Dr. Chris, I'm very excited to have you in this panel, to be honest. Not only because of your personality, but because of what your company is doing, the early diagnosis of genetic conditions in newborn. This is really exciting, and for me, it's very important. And as we are trying to build the ecosystem for vaccine production and biopharma products generally in Africa, where do you think your company properly fits into this picture?
Yes.
Where do you think your company properly fits into this picture?
So first of all, I think this is an excellent question. I think Professor Mutesa very nice framed the whole picture, I think. First of all, when we talk about pandemics, we talk about events which affect millions, hundreds of millions, billions of people. I think we have to keep this in mind. Scale matters. Now, when you do an experiment or analysis of 100 or 1,000 of people, it's not the same if you do analysis of experiment for 100,000 of people or 1 million of people. This is extremely important. Why? Because it's different when you want to go to understand the disease. When you want to understand everything, you have to go deep. You have to go to the genes. You have to see how the genes express themselves. You cannot do this by just doing an experiment, I repeat myself, for thousands of people. Now, in the world, the only screening, massive screening that we have is newborn screening. There is no other screening in the world except newborn screening. Unfortunately, newborn screening, it takes place only in global north, not in global south. When I say global north, to make myself clear, Europe, the US, a few, the so-called a little bit wealthier countries. In the world, we have 145 million new babies every year. Excuse me, yes, every year, newborns. Every year, 145 million. 95 million of these babies are born in Africa. Excuse me, in the global south. Many of them in Africa as well. Now, in the global north, they do newborn screening, but it helps only to diagnose, not to understand the disease. Which is, sorry to say that, it's a pity, it's a waste. I repeat myself, they do in Europe, in all European countries. They have excellent newborn screening. Depends on the country, they screen around 25 diseases. But they use biochemical methods. When you use biochemical methods, then basically what you do, you do reactions, chemical reactions. You can understand if someone has a disease, but you don't understand anything about the disease. I hope this is clear. Yeah. To understand the disease, we have to go to genetics. We have genetics. There are any good professor or hospital, especially in Global North, they can do genetics. But they cannot do it affordably, fast, and also you need experts. And this is the reason that they don't do it for newborn screening. Because, by the way, the newborn screening, I mentioned that we don't understand anything using biochemical methods for the disease, but also something else worth to mention is that they don't have good specificity. Meaning that we have a lot of false positive. You understand what is false positive? That basically you go to a parent and you say, you know something, your child has a spinal muscular atrophy. And then after 4 or 5 months when they do the confirmation, they say, sorry, you did not. You understand the health of the family. So again, you have a lot of false positives. You don't understand anything about the disease. And then, of course, because the genetic is expensive and you need a lot of experts, you don't do it for screening, you do it for confirmation. Now, what we offer, where we fit in the picture, not only for newborn screening, but also for pandemics, to understand the disease. Because if you understand the disease, then you can basically do better vaccination, better medicines. That's very important. So what we managed to do is basically to reduce the price significantly. Just to give you an idea, if you want to do a genetic diagnosis using a genetic technology, genomics, you need approximately a few thousand of euros or dollars. It's not cheap. You cannot do it for many people. Usually wealthy people can do that. Yes. Or wealthy countries like Sweden, Denmark, etc. Okay. Now, we managed to reduce the price less than $100, which is significant. In fact, it is cheaper than the biochemical methods that they use in Global North. That's the first thing. The second thing, which is even more important, and many people, especially the investors, do not understand that. Because they think, where is the innovation? The innovation is that you reduce the price, and the most important, that you automate it. Because let's assume that genetic screening or genetic tests are free. Free, zero price, not the 100 that I mentioned. Still, you will need, you know how many Professor Mutesas in Rwanda? To do it for all the population, for all the newborns. Probably around 1,000 Professor Mutesas. I'm not exaggerating. What does this mean? This means that probably 80% of all medical students from medical schools, they should be geneticists. Impossible. On top of this is for the interpretation. On top of this, and sorry that it took me a little bit long to explain what I want to say, but on top of this, in order to do the analysis, because for the sequencing, if you go to genetics, to DNA, you have a lot of data. When I say a lot of data, I mean massive amount of data. Billions and billions of data. In order to analyze that, if you do it as today happens, not with our technology, in general, then you will need probably 50% of all IT schools in the world and universities to be bioinformaticians. Forget it. In other words, you have to automate it. And everybody, all of us speak about AI, machine learning, etc., etc. This is what we do. We manage to combine genomics and machine learning, and through this, we reduce significantly the price, and the most important, we automate it. Now, to go to a little bit advertise our technology now, right? Now I go to answer your question. By doing this, not only we will help the newborns and to reduce the infant mortality. Infant mortality in Rwanda is 25 in 1,000. In Denmark, it's 3 per 1,000. In Sweden, the same. In Africa, average is 75. So in other words, congratulations to Rwanda. You are one of the best in Africa. And that's why we are so happy to have a collaboration with Professor Mutesa. And thank you so much, Your Excellency, for helping us to do this here in Rwanda. So, number one, we are going to help to reduce the infant mortality. But most important, something that not many people understand, that we are going to understand the diseases. And by understanding the diseases, by understanding the genes and how they express, then we are going to help the pandemics. And not only this, also to have drugs, medicine, that they are not just trial and error, that it happens today. Okay, you see your watch means I have to stop. Thank you.
Thank you very much. That is very detailed response, and I actually enjoyed it. And I'm actually, I'm educated about your program and what you do generally, and we really appreciate that. And you know, as an African living in Rwanda, I can tell you for free that Rwanda is a very conducive environment for investment. Any kind of investment you can think about. I can tell you that for free. And I'm very excited that we have Dr. Albert here, who represents the Ministry of Health. And this comes to my next question, that we know that to have a very vibrant ecosystem for production of vaccine and other biopharma products, there's a need for some incentives. There's a need for some a very conducive investment conditions for investors to be attracted to this country and to invest on that. In your own opinion, what do you think the government can offer in terms of incentives, in terms of a conducive investment conditions for investors to come and make some investment in that regard?
Thank you very much for this very important question. I will reflect on it using the lived experience, what we've gone through, and what we are planning to do. And by the end of my reflection, I will ask Dr. Chris if he's ready to come today. So Rwanda has been trying to be a key player in this area of biomanufacturing and vaccine innovation ecosystem. And our role can be understood in 3 ways. One is about hosting investments. Secondly is to act as enabler. And lastly, which is not the last, but we try to provide room for proof of concept. So now, if you start by hosting, we've been providing home to big investments, and one of the key example is the BioNTech mRNA facility that is hosted here in Kigali, which is basically aiming to support the production of vaccines in Africa. But again, this shows how Rwanda is bold in terms of pushing not only Rwanda but also the continent to shift from very high dependency to imported vaccines and other health products. So we are always open to new initiatives that really pushes in that sense. Secondly, in terms of being enabler, we have designed and put in place policies and regulations which are really needed for this ecosystem to grow. For example, if you look at the National Health Sector Strategic Plan, which is the guiding document for the next 5 years up to 2030, you can see clearly research, innovation, biomanufacturing, regulation, and digitalization is one of the 5 pillars in that strategic plan, which means biomanufacturing or vaccine innovation is not being approached as a standalone project. Rather, it's part of a broader national effort. Secondly, in terms of regulation, I'm happy Prof. Leon talked about Africa Medicines Agency. We are lucky to host it here in Rwanda, the headquarters, which is a golden opportunity for us to shape the regulation of medicines, vaccines, and other health products for the whole continent. So, but looking at the two offers, opportunities we are giving, we always try to link it with the health security and emergency preparedness, because we don't want to have only industrial development, but we want also to link this with what is needed on field when we talk about pandemics or epidemics. And this is coming from the lived experience we had with different outbreaks. Everyone remember the COVID pandemic, but specifically for us, last 2 years, we experienced Marburg outbreak, which proved us that everyone needs to have access to the right tools to build on the rapid coordination within countries, which is going to lead to effective response. So we are not really stopping at the level of industrial development. We also look at strategic sovereignty for countries, resilience, but also opportunity for more partnerships. So that's what I can say. Thank you.
Thank you very much for that insight. You know, when we're talking about ecosystem of vaccine, a very important gap that most people left out is the logistics. It's one thing to produce the vaccine and product, it's another thing to get it delivered to people that actually need those vaccines. Especially in Africa, where we have, I imagine how children in the remote villages, remote areas are going to get access to the drugs and vaccine they required. And that is why I feel the contribution of Dr. Mo Ibrahim is quite important. As the MD of IFS, you are trying to break the barrier of logistic problem. And I would like you to tell us briefly what your company is all about and how do you think this problem of logistics from site of production to the site when those drugs and vaccines are needed can be actually solved. Thank you.
Thank you very much for giving this opportunity for me to talk a little bit about important topic, which is institutional voids. And if I want to define what is institutional voids in one word, it's fragmentation of the systems. It's not necessary to be because of the resources. This is highly relevant in low and middle income countries, the countries that they have the willingness to develop, but at the same time, they develop systems or institutions, not necessarily thinking about for those institutions talk to each other or coordinate capacity building, coordinate operations, and so on. So there's always room of improvement when building these institutions to optimize operations through targeting institutional voids. So in the context of what we do right now in Rwanda, we came with a project to tackle emergency care, emergency medical services void. In the Rwandan context, Rwanda did a very good job in building emergency system since 2007. And they have invested in this system, in building a robust system. But still, that being said, still there is a room of improvement if we allow for a room of communication and coordination. There's a very challenging problems that happen if we are not tackling these problems. So in EMS context, there's 3 delays in seeking help in the emergencies, receiving, and reaching. So in order for us to optimize the already built system, we need to address every single delay in the best way possible. So for that, we need to sit from behind as private company if we want to do real partnerships with the government. So we need to build upon what they are already existing in the systems and see the gap and try to fill the gap from that perspective. So we need to sit behind and see what we can improve in regard of making these systems. So for example, communication system between different elements of emergencies can help a lot in minimizing those 3 delays. So back to my point of fragmentation, in a more broader perspective in low and middle income country, 22,000 deaths global-wide in the low and middle income countries, half of them because of the emergencies that can happen everywhere in low and middle income countries. But at the same time, 45% of those emergencies can be addressed by having a robust communication system that is efficient, that can bridge the gap of the already existing systems. Yep.
Thank you very much. Okay. I've been notified that the time is against us. I wish I had more time to have more interaction, but I think in summary, I would like to say that this discussion has been very thoughtful and very important. I personally have gained some insight about how we can have a vibrant ecosystem. But if you permit me, let me ask just one question to Prof. Mutesa on this Math Plus project again. We talked about it. You earlier mentioned about the issue of brain drain in Africa specifically. And we know if we really want to make this company work and do their job in Africa, particularly in Rwanda, we must make sure that we keep those experts. How do you think we can keep them here?
A very good question. It's also one of the strategy of MAFPRAS. So just 3 points on this. One is just to develop a high pipeline of talent and also a high quality of education. So what does it mean? It means like instead of doing like we used to do, sending students from Rwanda outside, get exposure, very good training, and they come back Rwanda, and then you get lost because you don't have the same environment, the same equipment. So we are doing this by attracting the professors. That's why we work with very good top universities. We are partnering with Swedish universities like Karolinska University, Gothenburg, and among others. So we attract this professor to train on ground. And also we build the lab capacity, which means that the same equipment we are supposed to go and see in Europe, America, is going to be here, which means that is number one strategy just to make sure that you have a quality of education which is the same standard like someone trained abroad. Number two is just to retain this workforce by creating high skilled jobs in this context. So we need just to think that how we shift from fill and finish to end-to-end, for example, for vaccine by manufacturing. I mentioned we are really starting there on the fill and finish with 1% only production from the African continent, where we need really skills to develop from end to end, from the vaccine development up to the vaccine regulatory and up even to the market. So this is also some of the strategy. And lastly is just the environment, in the conducive environment. Of course, the government supports leadership, but also in this environment, you also need to have where you can just attract the scientists, the African scientists, to remain here on the continent, but also giving the opportunity to have the IP, intellectual property, for example, patents, also being just registered in Rwanda in this context. Then you can just achieve this.
Thank you very much. I wish we had more time, but I think I hope in the nearest future we have another opportunity to have a similar discussion, probably in another forum. Thank you very much, and we hope to see you next time. Thank you.
Another round of applause for our panelists. And thank you, Dr. Ismail, for asking just the right questions. So as we continue, we will go now into education for this moment. And we will move to a panel that is titled Education, Leadership and Institutional Collaboration in Africa. This is a panel discussion that is going to be exploring how universities across Africa and Europe can collaborate and strengthen leadership and knowledge exchange in higher education. This is a panel that is going to be moderated by Dr. Raymond Ndikumana, Deputy Vice Chancellor for Strategic Planning and Administration. Please, a round of applause for our moderator. Thank you. And joining him on the panel is Dr. Fabien Hadjenimana, former Vice Chancellor of Ines Ruhengeri. Coming up is Mr. Kari-Pekka Murtonen, Chief Specialist and Head of Global Action at Jyväskylä University of Applied Sciences in Finland. And we have also Ms. Minna Suuttari, Vice Rector at Lab University of Applied Sciences in Finland. And we have Professor Natalia Tochelovska, I apologize, from Riga Graduate School of Law. Oh, she's not attending today, sorry. And also to end the list of our panelists, we have Dr. Sibomana Aimable, Director of Quality Assurance at the Catholic University of Rwanda. Thank you, everyone, and over to you, Doctor.
Good morning. Colleagues, partners, and guests from Nordic countries, it's a pleasure for me to be here, moderating this panel, Shifting to Education, Leadership and Institutional Collaboration. You know, universities in Africa and I guess across the world, we are in a moment of transformation where we are dealing with issues such as expanding access while safeguarding quality, developing talent, as was mentioned, responding to labor market shifts, accelerating digitalization, you know, and also going for global partnership that are really meaningful beyond just mobility. And if we have to do that, or to be successful in that endeavor, leadership is everything. Institutional collaboration is everything. I will ask, even though the moderator introduced in my panel, I asked each of you to introduce yourself a little bit, but also mention one collaboration that shaped your leadership thinking, and then we get on. As We have 45 minutes, I was informed, so we try to be quick.
I'm Father Fabian Hagenimana, former Vice Chancellor of Ines Rwanda, and the collaboration that shaped our university was with universities in Germany and Netherlands when we were shifting from classic university to University of Applied Sciences concept.
Yeah. All right. Hello, everyone. My name is Kari-Pekka Murtonen, and I come from YAMK University of Applied Sciences, and I'm focus area lead of, it's a bit complex name, multidisciplinary digital rehabilitation. So our university is divided to different schools, but on top of that, we have three main focus areas, so I'm leading one of them. I grew up in Tanzania, I live in Zanzibar, so I'm mostly based in East Africa. And worked in 20 countries, so when I say something, that probably is, those learnings will be reflected. So what I've learned, I think the biggest thing what has shaped the leadership is that we need to spend enough time talking and understanding each other. And this is not just between the cultures and context, but I think it's generally also when you're building interdisciplinary work. So what we've learned a lot when I talk about our specialization area is that when I talk, let's say, with the tech community, they look at it from their own perspective, while we look at it from our own sort of rights perspective, persons with disabilities perspective. And if you don't spend enough time, it's very difficult to find the understanding that you can build new solutions, innovations, and something that can impact the community at large.
Hello, everybody. My name is Minna Suutari, and I work as Vice President at Lab University of Applied Sciences in Finland. So I represent also the multidisciplinary university where the applied research and the collaboration with industries and other organizations is in the focus, both in education and in RDI. And if I think about the collaboration in general, I think my Finnish colleague already said the main point that I had in mind as well. It's really important that you are committed in long term to build up the kind of possibilities for win-win collaboration, that from both sides you can find the reason why we are doing this. So building up trust and doing things together, co-creating, I think those have been said quite many times already this morning, and I think they are the most important things.
Yeah, greetings from the Catholic University of Rwanda. I'm Dr. Mable Somana, the Director of Quality Assurance. About the cooperation we are excited in, actually there are 3 in 1. We signed 3 MOU during the last Rwanda Nordic-Baltic Forum. We are implementing a dual-degree program with Sianoka University of Applied Science and developing another one. This dual-degree program is in food processing. We are also developing a dual-degree program in e-commerce. Then we are partnering with Lab University from the same country in nursing program, and we are developing a bachelor program of early childhood education with the campus company from Finland. Thank you.
Thank you, very good. That makes my job simpler. So we focus not on theories, but on insight of what works and what fails, and actually what changes need to happen if we are to build our institution. So let's begin with Father Fabian. So you led Ines Ruhengeri, the period of expansion and reform. So from your leadership perspective, what institutional needs pushed you to go for international collaboration, and really what convinced you that the partner is the right fit for you?
Thank you. What made us build partnership is mostly that we had a clear idea of what we wanted. And then we had passion for it, and we met the right faces. For the idea that we had, Ines Rwengeri was created in the resilient context of Rwanda. So we wanted to contribute to give signs of hope, contribute to unity and reconciliation, but also to contribute to sustainable development. And that led us, as we were trying to shape the university, after checking what was happening in universities around, we realized that Africa has a syndrome of degree syndrome. People look for papers. We said it's time to shift from papers to people. And then we said, how do we go about? Because the academic products are not meeting the market needs, are not meeting the community needs, are not meeting the professional bodies' needs. What do we do? And we found that we can always talk about quality education, but if you don't act on it, it remains a slogan. So that's how we came up with borrowing the concept of University of Applied Sciences, the Fachhochschule in Germany. Not necessarily that we are copying and pasting, but trying to adapt the model of University of Applied Sciences because it is practical, it marries academia and industry, industry not just manufacturing, but the work of the place of work, and it also helps professionals to grow with one leg also in the academia. Then they shape the academic products for life. So that's what we did, and it required to change the mindset of the staff, but also to change the mindset of the industry and to tap into the digital revolution that is taking place. We did it, we tried, and we found the right institutions that accepted to partner with us, and then we shaped. But still, we have difficulties because we still need to train staff. The academic staff are produced by ordinary universities, but they need to get that mindset, but also to get the right infrastructures, to get the right partnership, because the industry is like adamant to come into the academia. They are waiting for the ripe fruits, but they don't want to participate in the production of those fruits. So we are working hard, and the partnerships that we are developing with the Nordic universities, some MOUs have been signed, others are ongoing, and we are talking about also the 4 partnerships that are going to work with the global health hub. So we are trying to see how we can build this model of a university that's responsive to community needs, to community transformation.
Thanks a lot. We will come back to the MOU question later on. But Kerry, from your experience, can really an institution internationalize while staying locally grounded? From your leadership point of view, what do you think?
Yes, thank you for the questions, and I'm sorry I'm going to answer this a little long, but I promise next one I'll do shorter.
Please.
I think in this process, one important shift is sort of decolonializing our mindset. And I think this is not just from sort of global north to global south, but also in global south, and for a few reasons. So instead of exporting and importing models, I think successful institutions sort of approach partnerships with humility and sort of curiosity, and co-design together. So if I think our university, in first place when we started around 5 years ago with University of Rwanda and Center of Excellence of Biomedical Engineering, and with the rehabilitation community, we came here to learn. And some of the things we've done here are now piloted in the Finnish healthcare system. So from the start, that has been our approach. So of course we might be able to contribute to something, but it's always learning both ways. So that being said, outside of box thinking is very important among leadership and investment decisions in both institutions, of course. And I think the very beauty of international cooperation is that when we let's say that when we worked always in certain type of context, it's very difficult to see that innovations, how to build real innovations that would scale, even if you would sort of have the knowledge in hand. So therefore you need sort of more time, what I mentioned also in the beginning as one of the key learnings. So We've heard a lot about AI, and I'll take an example from the digital, something we call digital rehabilitation. But also when we look into the role of higher education in the system transformation, I think higher education, in my view, has a huge role of transforming societies, and especially if you're looking emerging technologies. And it has it both ways. The workforce we train need to be trained for future. So we shouldn't train for today's problems. Also, we cannot scale any of these amazing innovations without doing it safely, without doing it, evidence-based approach first. And that's where higher education has a very important role to play. Short example, what we did with University of Rwanda and Center of Excellence in Biomedical Engineering and Health is that we started looking a solution to a huge global problem and a problem in Rwanda from the things that already existed in the country. So healthcare models in global north, they are probably hundreds of years old. And we are still trying to build systems on top of these models. And yes, they can work in a specialized healthcare, but if we look at like what many African countries have done, that they have utilized voluntarism, and they've actually been able to improve population health with simple, scalable models, and we should never overlook those, because reaching millions of people and improving their health is never easy. So from rehabilitation perspective, 2.6 billion people globally would benefit from rehabilitation services, and that is increasing through the non-communicable diseases. And that means that millions in Rwanda actually are living with certain type of health condition that could benefit from rehabilitative care. And for example, back pain is one of the biggest contributors. People consume healthcare services for back pain. They are out of work for some time, loss of income, and so on. So easy to treat, but actually can end up being quite costly. And unfortunately, too often operated through the expensive system. So in Rwanda, for example, there is around 300 physiotherapists in this country. And if Rwanda would like to train similar level to Finland, that would mean that they would need to have 50,000. So everybody could calculate what it means. But with integrating different digital models, what we started testing, the population could be served with much less. So with our research project and a cooperation, we started looking at what if we completely think this differently? That what if we find a way to identify at very early using something that already exists in the community and providing a digital solution. So we built up a test bed that today in Rwanda alone, same has been tested in Indonesia, a little bit in Tanzania, Kenya, Vietnam. But in Rwanda alone, 16,000 people have been part of the test beds. And we've been able to show that with early identification, digital intervention, now we are testing it with AI, over 90% of people could be treated at community level. But what was shocking to us is that it's much more cost effectively when we engaged health economists to calculate it. But what was a surprise to us that it is actually even more effective than sending people to hospital to meet the nurse, the doctor, take the x-rays, and so on. So only thing that we are now working with AI is that how can we do it so safely that we identify red flags, we can integrate people to the program, treat them, and in case if there is something more complex, then we can enroll them to the more specialized care.
And that was locally grounded, right?
Sorry?
And that was locally grounded, that initiative.
Yes, exactly. And I wanted to take that example because we did not start building on the sort of models or restrictions that we probably have in Finland. And like I said, that when we managed to do that and test the scale, and now we're testing it on AI, what we actually learned, because we built up an AI platform at the same time testing in 5 countries. Okay. This is now tested in Finland as a part of the government pilot for direct reimbursement of getting services through AI system. And this was actually grounded in Rwanda first.
Very good. But let's talk, Mina, I mean, you are a university leader, and if you hear this, we are many academics here, it may sound like easy, but how do you actually balance the academic ambition and the societal impact, and what leadership shifts are needed from your experience from Africa? I'm asking Dr. Minna to say something.
Yeah, thank you very much, and that's a very good question, and actually one of my favorite themes when leading the research, development, and innovation activities, because I think it is the most crucial thing for the prosperity of societies that we are able to turn academic research into impactful results in the society, and I believe we can all agree on that in this room. I cannot give you, I don't want to give you any hints how you should do it here, but I'd like to share a few of my own experiences, because then you can think if they you know, are something that you'd like to do. What we have done in our university is that we've chosen a very strong research profile that supports our education, and we link them together so that we are able to you know, take the research findings and results into education when we train the future professionals. And I think that this kind of strategy-oriented way to do RDI is a very good way to show the impact also to the surrounding society. Then another thing that I think it is really hard for most researchers, because everybody loves their own cozy place in their own research you know, area, and they would like to, you know, focus on those nice questions that they have made up themselves and you know, doing the valuable research. But then we should somehow try to push these people to discuss with the overall world. And we in Finland like to use the kind of model where we start from the needs to understand what is actually there, what are the questions we should be facing at, what kind of problems we should be helping these people with. And then we start thinking about the approach. We have the huge knowledge base in our research, but we shouldn't go there with the approach to other organizations, companies, public organizations. We shouldn't go there only with our own approach, but first understand the need, and then start challenging this need with this approach. Because it is also known that when you have quite a lot of you know, academic understanding of phenomena, you should be able also to encourage and challenge, for example, SMEs to think their you know, way of doing things differently. So with this approach, then we can show what are the benefits that are going to be created to different kinds of ways. So I think this is the kind of you know, thinking model that can help to change the you know, moving from the only academic thinking towards the kind of a more valuable societal impact. And I think it works with us at least quite well. But then how to lead this? So I think that, you know, encouraging people to co-creation and co-innovation with very different kind of thinkers, with different kind of actors, not just, you know, the like-minded, but also those that challenge you. And then provide the kind of collaborative environments, innovative environments where you can come together, where you can collect these different minds together. And then, of course, you should also be measuring other things than academic impact. So not just looking at the review articles, how many they wrote them, and where did they you know, how much they were cited, but also to look at what kind of impact they actually had in the society. And this is the hardest part, I know, but I think that, you know, leading excellent research starts from understanding that what are actually the impacts we should find out, and then measure those people through these impacts. So basically this is how I think and how we do this in Finland, and I hope you can pick up something also for you from here.
But is this something you're applying for your project around the emergency system, management system? Is it really something that you apply in this project with Rwanda?
Yeah, I think that, you know, all the projects that we do, of course, over there, we try to bring together the research excellence and then understand the societal impact that these can have. So this is a kind of overall frame. I didn't go into details in the certain project, but of course that's an approach that we would like to see happening also here.
Aimable, from the quality assurance, you are in the quality assurance at the Catholic University. Do you see quality assurance being actually a driver for transformation or beyond being compliance? Because that's what often happens in universities. So what internal readiness must exist if an institution enters such collaboration, the one that you mentioned with Finnish universities?
Yeah, thank you. Actually, the previous speaker said that Rwanda is a conducive environment for investment. For higher education should be a conducive environment for teaching and learning. For quality education, quality resources, quality teaching and learning process, quality infrastructure, and experts being in place brings quality education. Now, for quality assurance to be a driver for transformation, we need to shift from checklist for compliance, but improve the process of teaching and learning, assess whether you are on track or not, then give feedback. While giving feedback, the end result will be really the result you were expecting. Now, Rwanda is implementing competence-based education, where knowledge, skills, attitude, and value, they are combined to prepare candidates who are really competent for the 21st learning centuries. At the Catholic University of Rwanda, we used to say, combining knowledge, skills, Christianity to cultivate humanity. So when you are training in such a way, you make sure that if you are training someone today, is he getting the real competence that is needed for tomorrow's journey, for what the country really needs? Rwanda is aiming for a knowledge-based economy. For those persons who will be serving, and after consulting industry employers, the competencies that will be needed in the future, are we training people who really will respond or will serve for that very skills which are needed to solve problems of the society? So that process, that is what I see as a quality assurance which is needed, instead of waiting the competencies at the end of the circle, rather during the process. Thank you.
Thank you very much. Essentially, what all of you are mentioning, we need enabling environment for things to work.
Sure.
But you talked about what works. Let me ask each of you, what fails? Father Fabian.
What fails is commitment. Mm-hmm. Commitment of the people is not to be taken for granted, because it's very easy to talk about, but to find the right people who are committed in the university, but even in the partnership, it's not easy. So that's it should be addressed always.
Thank you. 1 minute, Kari. What fails?
I think the biggest learning is that people are also very busy, and why that's one of the things when we want to see it from programmatic perspective, that we build things long term. So trying to go pole, but taking, which is Swahili word for going slow, but then understanding different things, that how they are interlinked. Like for our research needs to interlink with future curricula and skills. So there must be that. So it's very easy to fail on that one, and that's where we are trying to work, and I guess we fail, and then we build again on bringing that comprehensive approach.
Dr. Mina?
I also think that commitment is the phase where you most easily fail. You don't find those people who walk the talk and do these things. And the other one is that we don't understand how much time we have to, take for this kind of collaboration. They are long-term projects, and they fail if we think that after the first visit to Rwanda, I think that nothing came out of that and I don't continue. So I think it's persistency that you need over here.
Emmabre, do you concur?
Yes, I do concur. Commitment, transparency, and accountability. With having strong quality assurance mechanism in our schools.
Very good. I still have 10 minutes for this panel, and at least that's what I was told by Chantal. So, but we are not going to use all of them, and I just want to ask you the last question. So, what is the one thing, in your opinion, after talking about all this, that Africa must stop doing, and one thing it must start doing in a higher education partnership? Just 1 minute reflection and we close this.
Africa should stop waiting for the global north to bring everything, but rather suggest what can be understood in a win-win context for both to benefit.
Okay.
Africa is 54 to 55 countries, depending who you ask. So I guess there is 54, 55 models. But I think the main thing is not trying to copy the Western models, but build through local models, whether it's higher education, whether it's anything that we talked about.
Very good.
I also think that, you know, you should trust on your own knowledge base and competencies and start building the collaboration from your needs. Of course, listen to others, what they have in their mind, but then see that maybe this is not the right one for us, or maybe we should somehow, you know, formulate this. So not being copycats. I don't know if you are doing that at all anymore, but still, you know, trying to find the own identity, how to do things, and learn from others, listen to others, and take the benefits from that. So I think that's where the good base starts from.
Yeah, I think I concur with Father Dr. Fabien that African universities should enter cooperation not as dependent, but having commitment of that win-win situation. Thank you.
Thank you very much. That marks the end of this panel. Unfortunately, we didn't have time for you, the audience. I think you needed a little bit of that, but we're going to do that in the other panels. And thanks.
Thank you.
That was
Thank
good.
Thank you very much, Dr. Raymond, and to the awesome panelists who answered the questions very satisfiably. I would like to take this moment to invite Ms. Nulufal Garavi, the Secretary General of Euro-Nordic Funding Alliance, for a presentation. Let us all offer her a round of applause as she comes to the front.
Can you hear me now? Okay, I'm not used to standing and talking, so it's a little bit, I mean, standing in one place. I like to walk, but that's the setup now. Hello, everyone. I tried to say hi and good afternoon yesterday in Rwandan language. I'm not going to try it right now unless I master my pronunciation. But my name is Nilüfer Garavi. I'm Secretary General and founder of Euro-Nordic Funding Alliance and author of the book Save the World Before Breakfast. To brief you very quickly a little bit about the book, which is also the foundation of the organization that I will talk about, is that, oh, perfect. Perfect, that's better. So I'm by profession a systemic designer, built multiple different products, including, something like hardwares like in my hand. And the book tries to kind of introduce the knowledge and the trainings and the way that designers think and build a lot of different things from scratch into the business in order for us to think that every system and every product and every environment that is around us, they have been once designed by different people and institutions. It means that they can eventually be redesigned if we think about them. Because most often we take it for granted about the world that is around us. We're born into how the public transport system works or how the different cities are shaped. But if you for a moment think that this glass, you can drink the water in 50 different ways, that's when your eyes open to the possibilities of change, which I believe is quite necessary for the world we're living in when it comes to the sustainability issues. So that's a little bit the mandate of the book, which is also the foundation of Euro-Nordic Funding Alliance. Euro-Nordic is a group of very senior, well-connected business development and finance structuring people across 21 countries. Every individual that was shown on the image previous image, they have very broad contact in their own jurisdictions, in their own region and the country where they represent, very, very close connected to the private sector, to the public sector, and they are very senior into business development and finance structuring. And with that group of people, approximately something around 50 people, we are able to invite a lot of different organizations to partner with us and support them with cross-border business development and blended financing. So for example, I'm sure that in the room we have a lot of organizations that are like chambers. They have loads of SMEs and research institutions under their portfolio, or we have universities that have loads of technology that has been produced under their portfolio, or a lot of organizations that each of them they work with finance structuring, funding, donations. In the room, there are so many resourceful people. All these type of organizations across those 21 countries, they become our partner, a strategic partner. And with that strategic partner, and with the team that I presented, what we do is basically we invite a lot of incredible SMEs and technology holding companies to join us as members. And then we help them with matching them into strategic projects cross-border, and then support them with getting financing and grow their business. I know what I'm saying is very high level. It's very kind of strategic and systemic. We have to bring loads of different stakeholders together. But all we do is to structure bankable, realistic projects with very strong foundation out of different technologies or different companies that want to grow into new markets, and then we invite financing into them. The financing comes from private equity firms, family offices, a lot of different institutional investors or private investors that trust us because we have shown them results and credibility. Now, we also do a lot of events, such as this one, and participate at them, try to talk to them. A lot of our members, they meet us all across these 21 countries where we exist today. And the purpose of that is to get access to high-quality companies and individuals that have incredible technologies or something very valuable to offer, for us to bring them on board, put them into structures of our projects, and support with financing and growth. So there are like loads of events. Last year we co-hosted something around 30 events across Europe and Africa, and expanding our network through there. That is also how we get access to all those investors that collaborate with us very directly. Now, to give you the summary of everything I said, we are headquartered as an institution in Norway, Sweden, and now opening in Luxembourg as well. And what we do is cross-border business development and blended financing through all those partnerships and various actors that we onboard. And what is the result of that? It basically does business, soft landing, and market expansion. To make it concrete for you, we have one of our national offices is in Dubai. And there are a lot of Nordic companies that want to get access to the possibilities that are in the Gulf region. So our Dubai team, they in particular give a service for business soft landing and market expansion. At the same time, we have companies here in Rwanda that are going to join me here on the stage afterwards. We help them to grow into European market, into the Nordic market. So it's a lot of different things, especially for early stage SMEs with very bankable and repeatable or kind of trusted projects or products that are struggling to grow. We help them to look into new markets if they are struggling in their own kind of small market where they exist. We also do tech and know-how transfer. It's incredibly important, especially for the European markets. I mean, Europe has invested so much into R&D through all these EU Commission programs, but the market for a lot of these technologies are quite limited within Europe, so we're kind of open other markets to them. A lot of them go to the US, but now that environment is quite volatile right now, so we help them, for example, to come to Africa and safeguard their technology and grow them there. We also do a lot of capacity building, which is quite important because not all the SMEs and partners that we onboard have similar knowledge or similar capacity for doing the business that we require them to do. So we also do a lot of training, for example, business development training, introduction to grants, because it's all about blended financing. We both do private equity and also public funding. So it's very, very key. So the companies that join our network, either as partner or as members, they really learn a lot throughout the process as well, which is important to us. At the same time, we do project and deal structuring. What does that mean? It means that it not necessarily comes from an SME or a technology company, but someone that is close to a government or someone that is close to a very big asset-heavy project somewhere in one of the countries. They normally bring the projects to us. We help them to make it bankable, to structure the project to an extent that it becomes presentable to European standard investors, and then we support those deals to get financing. And also finance structuring is part of it. So it usually happens through blended finance. Some of the smaller projects, they attract grants. Some of them, most of them, they attract private equity or family office investments into it. But also we engage banks for debt. So it's a mix of debt, equity, and multiple different functions. Our financing have different brackets. Some of our smallest projects is between 200 to 500,000 euros. There are small projects, bringing them into investments is very difficult. So we, for example, engage them into public grants. That is a much faster go-to-market and access to financing for them. But then when it goes to other brackets, we have been structuring financing for much larger projects as well. And I must admit, from personal experience, honestly, structuring 100 million is much easier than structuring 500,000, to be frank. It's just completely a different ballpark. But what we also do, to give an update about our structure, because so far we have been operating as a non-profit, headquartered in Norway. The reason for that is that we basically get a membership fee at the beginning, which is very humble and simple to onboard high-quality companies. But then we participate with, again, humble commission into the process, or we take equity. So we don't invest directly ourselves, but now we're actually able to, we're establishing a holding and a fund in Luxembourg, and that is because of the bigger investments we have done. We're enabled to use 10% of those investors and commissions and recap it into smaller projects to actually finance them ourselves. So it's important for us to also do a lot of refinancing for the projects that join us. Now, on the stage, I would like to invite some of our members in Rwanda to give you the real picture. Would you please join me on the stage, and will you give them a round of applause? Please. Agnes, everyone. Please, join me here. Please, don't be shy, come on. And it's incredible to see that most of the members that are present here are actually women. Come on, come on. Thank you very much for joining me here. I would like to give the mic to I want to make things real for you, because everything we say, it sounds great, but I want to tell you that it's actually real. So I would like to give the mic to Regina. She is one of our people on the ground here, the people on the ground here as our relationship manager and managing director. One of the people on the slide I showed you as an example. And Regina, would you please explain the context and how we have involved these lovely people and where we started here?
Thank you. How are you, everybody? My name is Regina Kamsinga. I'm the relationship manager, AMFA, here in based in Rwanda. I'm an entrepreneur, but before that, I worked for Development Bank of Rwanda. So I worked for 14 years. So yesterday, Neil talked about the 20, if you can bring the 20% as your contribution, she can guarantee the 80%. So the reason why she talked about 20% is that she knows what the DFIs needs, the financial institutions need. They need your 20%, at least when you bring your 20% in the project, the follow-up is assured. And when you don't bring anything, you let everything go. So it is really very, very important. So I'm here in Rwanda. We managed to mobilize these companies. These are the representatives of these companies. They are members already of AMFA. What we are doing for them is that we are doing the application. We already started the application for their funding. So they are going to testify. We started the capacity building already. So they are going to say something, everybody's going to say something that he has experienced, she or he has experienced in AMFA. Please welcome.
Please come a bit more
Okay.
front, please. So everyone sees you.
Thank you.
And just a second. I must say, this is my first time meeting them. So that's the incredible thing. And then I'm going to Ghana afterwards. It's such a privileged life, to be honest. There you go.
Thank you very much. Thank you very much, Niro, Regina, and everyone. I am Jean-Claude Mwiseneza. I am the Executive Director of Land Work Develop. It's a locally registered NGO here in Rwanda, but also we have a social enterprise, as they were saying. So I'm a man, but also our organization is also empowering the children, women, and the youth. As you know, we have different issues here, and we have a lot of initiatives, but we have had a problem of increase of teenage pregnancies here in Rwanda. As far as the DHS is concerned, we have discovered that it increased from 2020 from 5 to 80%, so it's a problem. But in our organization, we have a model that we tested since 2020, and we are working with ENFA to see how we can have the potential partners who can join us, and we see how to also decrease the teenage pregnancies rate here in Rwanda, as it is also in the Nordic countries. I have seen, I have checked the way it is, so we have to see how to collaborate and to empower our model, which is Masenje Mbahafi. So it's a female model, which is in English, Auntie Be Close to Me. So we have also the AWD cycling team, of which some are the girls and the boys, where we challenge gender stereotypes, and also livelihood, and also some other activities in environmental protection. Thank you very much.
And if I just make your remark, thank you so much, please. So we have, by 5th of March, in this month, we have engaged them in 2 public funding applications. One of them is about female financial empowerment and independence. That is going to be particularly implemented with European partners in Europe, but then you would be coming to Europe and bringing your capacities into the project. Thank you so much.
Thank you so much, Nilu. Greetings, everyone. And you're welcome to Rwanda. Yes, my name is Uwera Agnes, and I'm the founder and CEO of Hanye Enterprise. Hanye, I think from where you're coming from, you can say Hagne. Yes, Hagne is a female-founded enterprise registered here in Rwanda since 2014. and it is founded on the basis that I grew up with my auntie, and she was very strong on selling honey. In fact, my life has a story of her contribution through selling honey. And so I want the legacy to continue. What do? I work with now 300 beekeepers with a specific and keen eye on female and youth beekeepers. I'm operating from the districts of Gicumbi, Nyagatare, and Kayonza, working with farmer cooperatives and farmer service centers to give them education on best farming practices, beekeeping, so that they can assure me of good quality honey, because that's the promise that I have for the people that consume that honey. I'm a graduate of social entrepreneurship from the Institute of Roxburgh, Institute of Sustainable Entrepreneurship. And so whatever I do, I know that the profit I get, I have to share with the community. What are we doing? We are solving the problem of adulterated honey on the market with the ambition that our honey can go to the global outreach. Currently, I'm keenly every day working towards building a fully fledged honey processing unit in the Eastern Province. My target is 2028, but I really would love if that can be shortened. And that's the journey that I'm working with AMFA. Thank you so much for the opportunity.
Your Excellency, ladies and gentlemen, good afternoon. My name is Margaret Wafula, and I am a Montessori trained teacher by profession. I recently attended the ENFA training focused on public funding for education, where we discussed on how Montessori curriculum can be adapted to serve the community. The Montessori curriculum is for children aged 15 months to 14 years, from pre-primary to elementary. And I think one of the presenters had talked before about pre-primary, and I'm very passionate about that. And so we are looking at and hoping that we can find passionate partners who will be able to work with us to forward this sector here in Rwanda. Thank you very much.
And we have already engaged them in another public funding application for youth entrepreneurship and empowerment and skill development that aligns a lot, and a school of Montessori in Lithuania is already a partner in that project as well.
Hi everyone. We are delighted to have you here in Rwanda. We like visitors. I'm Grace Mbabazi, the founder member of M&M Sozo. First of all, Sozo, its meaning itself means free freedom, mentally, physically, spiritually, everything. So according to the company name, I thought how we can uplift those women and youth who are vulnerable, those who did not get chance maybe to continue with the studies, or maybe they experienced things that stopped them from being developed. I work with 10 districts as per now, but my intention is to extend and up to each and every district. I keep bees, just beekeeper, but using those women. So far, I am dealing with the 6,000 people, 4,000 and 2,000 youth. My aim is just to change their mindset, to train them. Since we are just purchasing from somewhere else the honey, I decided just to keep bees through those women and youth. then I purchase from them as well. Also I built a training center for them and correction centers. Also, I'm trying to build a big in the compliant laboratory for honey. Thank you.
All right, thank you very much. Good afternoon, everyone. Good afternoon. Yes, my name is Blaise Mnyemana. I am the founder of 1MB Engineering. I'm an engineer turned entrepreneur. We are solving 3 problems of power stability in Rwanda. We have a very rapidly expanding grid that has just moved from just more than a few hundred connections, hundred of thousand connections in just a few years, and now it's in the millions. So we have a very rapidly expanding grid, but unfortunately it's expanding with its problems of instability, and therefore I hope you have not seen a bit of the voltage fluctuations, but that's what you're trying to solve, and we are solving it in 3 different ways. One of them is we have an issue that we are approaching it from a reactive point of view. So the grid has an issue, and that's when we start solving the problem. So you're trying to leverage AI to be able to use thermal imaging and diagnostic power to predict the issues before they happen, and therefore approach it from a more predictive approach. The second one is we are designing and optimizing the systems mostly for when the grid goes out, it has different impacts to different people. For an individual at home, it's probably a radio or a TV that burns. But for a hospital, it's a machine that was life supporting. For an industry, it's a whole line of production that has gone out, and those are millions of losses. And so we are solving it by optimizing their power stability and the power factor corrections and combining them in such a way that they stabilize the output side of it and while retaining the issues on the grid side. The third one is, I've been in the sector for more than 12 years now. And one of the issues we have is that our engineers, me being one of them, are not adequately trained to be able to bring it to the level of IEC standard that is adequate to handle the issues. And so what we are doing is trying to solve all those problems, and we're looking for partnerships in both the technology, because the EU has a lot of those, and also in the AI and also the education partnerships. And what you're offering is not just the grid that is rapidly expanding and therefore a good research area, but also a test bed for their technologies to be able to solve this problem that is has such massive impact. I mean, all the technologies we've talked about here, they're all reliant on energy, the AI, everything. And so for us to have stable energy, it's very important. Thank you very much. And ENFA has been absolutely key in helping us expand from just an idea to a more realistic venture. Thank you so much.
Sorry, I want just to add about ENFA. Their support was not intended just for me, was not intended to get money. That became just after. But the most important was their training, which really changed us. Thank you.
Thank you. Thank you, everyone. If we could please hurry it up.
Okay, just one addition is that in AWD you have trained more than 10,000 young people, and 80% of them are the girls. The girls who have had different issues that I have talked about, because they are among the uses compounded vulnerabilities, including the teen mothers, sex workers, including the uses disabilities and so on. So most of them were just in tailoring, hairdressing, but some of them also were trained in male-dominated trades, including the bicycle mechanics. You know bicycle mechanics? Okay, we used just to have like those local bicycles, but in Rwanda we are having a lot of high-end bicycles with new types like hybrid, mountain, road race. So we have trained a lot of girls in that domain. So we want just to scale their skills and then to engage them in the workforce. Thank you.
Thank you so much. Thank you for listening to our members. We really thank you for your attention. So whenever you need any service from ANFA, please call Regina. Thank you. I'm available for you every time, every moment. Thank you.
Thank you so much, please. Just a closing remark. Okay, thank you so much. I mean, I'm the one that travels and connects, and we bring them together. But this was just we not only bring them on the stage in their own countries, but also abroad. We try to represent them. We try to be their voice and grow their capacity with training and all. I just need 30 seconds to also show you, because the projects that we just showed are like on the first two brackets of the financing and support we do. But for example, we have our hands on one of your most strategic projects here in Rwanda and in the region. The lake, the development and recovery of the Lake Kivu is one of our strategic projects that goes on the much higher brackets, like between 50 and 100 million, and we're working on finance structuring for the development of the first phase of the project. We're also bringing a prefab factory to Rwanda with financing from our side, inviting part financing from locals to bring, it's a factory that is able to build a G+9 apartment in a week, which helps a lot with affordable housing, bringing high quality homes to people. We're bringing modular data centers, for example, in Egypt and Ethiopia, because of different electricity prices and energy prices. It can also be development into Rwanda. We're, for example, working on building up the Accra's coastline development project. In a lot of these, we bring European investors, Saudi investors into the projects, but we become the visibility of those projects. And most important is that we de-risk these investments for our investors. It's very important. We do the nitty-gritty job of structuring for each of these projects. And for being a development agency coming from Europe, trying to be super sustainable, we also have some refinery project. But why we take on board those projects is because no matter if we invest or not, they're going to be built. But what we do is to bring European high-class technology to the development. So for example, this refinery in Gabon, the technology is going to produce clean water out of the whole cycle for the neighborhood. So we have our hands over in a lot of projects, and what we're inviting is locals to take action so we can bring our assets and values to you. Thank you very much.
Thank you, Ms. Nolofar, for such an astute representation of ENFA's activities. And right now we're going to go for lunch, but before lunch I would like to announce that, as I've said before yesterday, that we have a visitation tomorrow to the Kigali's Genocide Memorial Site, and we're going to go at 10 a.m., but the bus is going to be leaving here at parking at 9:30. So when you go out, there's going to be registration for those who would like to go to the Genocide Memorial Site to visit and pay their respects to those that we lost. And also there is a tour expert and she's giving like tourism packages outside, also outside of just this room that we're in. And as we go for lunch, those who would like who still have some time here and they would like to see a little more of Rwanda, very beautiful Rwanda, by the way, then you would approach our tour guide. And also we have the Isanje One-Stop Center. It's right at the back of this room, and it's for businesses registration. And so now we're going to go for 1 hour lunch. Let us please be on time as we come back so that we can continue our program. And I expect all of you to be on time. Have a great lunch. Everybody enjoy your food.
on the panel. Yeah. We have so many important people here. You guys welcome and enjoy these discussions. Welcome to Rwanda.
Muri hano. So, Rwanda nziza. Rwanda is a beautiful country. We're happy to host you guys. And so now it's a group photo after this panel discussion. Thank you guys. Thank you for being with us.
Yes. Oh, hopefully, yeah. I think one thing that we always been talking about is the collaboration between Sweden and Rwanda, and hopefully working together inside the culture and the film and entertainment industry. I think there's a bright future. What do you think? Thank you so much. That is second.
Ladies and gentlemen, if you're still outside of the room, could you please come back inside so we can continue with our program of the day? Could everyone who is still please outside of the room come back inside so that we can continue? And if you're inside, please take your seats and could everyone please get back inside the room? Everybody please come back inside the room. Let us get started. Ladies and gentlemen, could we please get back inside the room so that we can continue with the program of the day? Could everybody please, who is still outside of the room, come back inside as we are past time? If everybody in the room could take their seats, as we will be starting in 2 minutes, and those outside, please get inside and take your seats so that we can proceed. If we could please hurry it up and move at a faster pace, get to our seats, and then we can continue. Could everybody please get inside and take their seats? If there is anybody here with a Honda car of blue color, and it is R as in red, A as in apple, G as in go, 221U, could you please go outside and give way as you're blocking other cars? A Honda blue color, RAG 221U. Yes, and we're starting. Ladies and gentlemen, I hope everybody had a wonderful and great time at lunch. I hope the food was delicious and that you managed to network with all the other interesting characters that are here in attendance. So if we could please take our seats and proceed. Thank you, everybody. And one last time, if you own a sky blue Honda car with the plaque of RAG, as in RAG 221U, could you please go move it so that you could give way, as you're blocking a lot of people. And welcome everybody to the second part of our day today here at the second Rwanda Nordic-Baltic and Nordic and Baltic Business Forum. I wanted to also remind everybody that Thank you, Your Excellency. Yes, I wanted to also remind everybody that the Zoom event is going to be at 2:30, and it's going to be at the same time as some panels happening here. So 2:30 to 4, if you want to attend, please do it. And now we are going to be continuing into our panels. And on behalf of our ambassador, Her Excellence Ambassador Dr. Diane Gashumba, I would like to apologize. If you see her leaving, that is because she has a meeting at the at the Ministry of Foreign Affairs. And so she will be going to that, but we'll be seeing her again. So now we will move to our next panel discussion that is titled Public-Private Partnerships in Higher Education and Strengthening University and Industry Collaboration. And this panel will be exploring how stronger collaborations between universities and industry can drive innovation, skills development, and industry collaboration. This discussion will be moderated by Professor Dr. Alfred Bizoza, an agricultural economist and policy analyst. If you could please give a round of applause for Dr. Yeah, and joining him on the panel is going to be Dr. Jaakko Halila, President and CEO of Seinäjoki University of Applied Sciences, Mr. Halila. And joining them as well will be Ms. Minna Suuttari, Vice Rector at Lab University of Applied Sciences. If you could please proceed. Yes, and then they are going to also be joined by Engineer Jean-Claude Bahati from Inyange Industries Limited in Rwanda. And lastly, they are going to be joined by Dr. Sylvie Mucho, Vice Chancellor of Rwanda Polytechnic. Ms. Mucho. Yes, and over to you, Doctor.
Thank you, Master of Ceremony. Thank you again. Good afternoon, everyone. Can you hear one? Good afternoon. Or at least, thank you. We are going to have this very important session, reflecting, as the Master of Ceremony has just mentioned, the feasibility, or how does it work to see the public and private entities working together in promoting research and innovation. So we'll also dwell on some of the concrete examples from different initiatives already going on that are going to be reflected by the panelists. Allow me to introduce quickly the panelists. We are with Dr. Jaakko Halila, who is just on my left side. He is the president and CEO of the Seinäjoki University of Applied Science in Finland. He holds also a Doctor of Administrative Science degree, and his doctoral research focused on transaction cost theory. He also holds a master's degree in international administration and completed part of his studies of science in Paris. So he has spent almost 11 years in regional government and international affairs manager, where he led and coordinated numerous international research and development and cooperation projects. So he's going to be with us sharing his experience. If you can applause for him. We are also with Dr. Sylvie Mucho, who is an environmentalist, environmental scientist by training, but also an expert in biowaste management and academic leader holding a PhD in applied environmental sciences for Battery University Dunde. She is currently serving as the Vice Chancellor of the Rwanda Polytechnic. And prior to this position, he served as a Deputy Vice Chancellor in charge of academics and research. And at the same time, he served in more than 12 years in academics. So this is also a good experience to celebrate. Thanks again to join this panel. So we are with Jean-Claude Bahati. He holds a master's degree in food technology with more than 16 years of experience in food industry. I think talking about food, we just have the food in a few minutes. So he's the one to make sure that the food we eat is safe and is of quality at a certain point. Am I right?
You are right.
So, and he's also currently the food safety manager at Inyang Industry, and he's responsible for food safety certification and compliance with statutory and regulatory requirements of at Inyang Industry. So he's going also to share with us the experience from the industrial area or the private sector. Welcome, Bahati. So we are with Dr. Mina Sutari. She works also as a vice president at Lab University of Applied Science. She was with us in the previous panel as well. And she has a long work history in the field of research and innovation. And before joining the lab, she worked around 16 years for Finnish Innovation Agency. So I think this is also a good experience to share and also to share within this debate around public and private partnerships. So we are going to start the questioning series. The first one, which I think is going to be reflected by everyone, just 2 to 3 minutes. Can we bring on board first your understanding about the partnerships of public and private entities or actors in the area of research and innovation? What is your understanding? How does it work? Maybe if we go through 2 minutes each, and then we set the stage for the next sub questions. Over to you. We start with you.
Murakose Chiene, Kutkwa Mesa. Thank you very much to Her Excellency Ambassador Diane, and I would especially also like to thank Seth from Hills Connect. We are here and we are doing the cooperation with Rwanda. I would like to talk a few words about triple helix model. Probably everybody is familiar with the triple helix model on paper. We are actually one of the places where we have the triple helix implemented under the same roof. There are a few places in the world, in Toronto, in Canada, in Sydney, I think in North Carolina, and in Seinäjoki. So I haven't found any other examples in Europe or in Africa. This means that we have the public authority which is funding R&D. In our campus, we have also over 100 companies that are on the same campus with us. And this makes it quite natural to do cooperation with the companies. But it shouldn't limit only to those companies who are right next to you. And it's true, the companies don't need to be present at the campus. But what is important is that the students are always preparing for the working life and for working in the company. So we always try to include so that our students are solving the real problems of real companies. They do their thesis on real problems of the companies, and also we try to solve so that we try to arrange so that they solve the real problems of the companies when they are writing their thesis. And we are really excited to be here in Rwanda with some partners who have a similar enthusiasm to develop this model in the future. And what makes it really important is also we have one of the main companies, Inyane, who is on board with us to develop this model. That's one of the things we are working with the partnering universities that we have, but also with the industry. So we are planning joint degree programs together with a couple of Rwandan institutions, and the idea is to include challenges from the industries in Rwanda and solve them together in Rwanda and in Finland, so in joint cooperation, and prepare students in automation and prepare students in food processing. We are the largest food technology and food processing university in Finland.
So where does the public comes in then, in
We
that
have-
particular collaboration?
That's a very good point. You have to have the public authorities committed in supporting this. So, for example, in our case, we have the regional government on the same buildings with us, and they are the ones who finance the R&D. They are financing authority. So you have to have a committed public authorities which are financing the cooperation. University doesn't have sufficient resources to do it without the public authorities. So it's an essential part of the triple helix model.
Correct, thank you. Dr. Sylvie, could you also elaborate more on this triple helix project? What is the role of Rwanda Polytechnic? And in fact, how did you come to know each other and become partners?
Thank you so much. And I would like first to thank the organizers of this forum, particularly His Excellency the Ambassador, for your leadership in this. So it came from her. So, yeah, the embassy. So you represent the embassy. So she connected us with the university, CMK. And I think from the beginning, that leadership commitment, that initiation helped to drive the whole process. So being leadership from the universities, us and CMK, the government, the ministry itself. So this has enabled to drive other activities that were involved. And of course, you have to develop relationships. You cannot have a successful triple helix model without developing relationships, without understanding each other and the needs of each party, and also a higher level of strategy. Because when we look at the country's strategy to develop our country as a knowledge-based economy, there are some interventions that have to be made, and in it there are skills development, there is research and innovation, and working closely with the industry. So from there, you have the industry leadership, you have all these parties' leadership, and then the commitments are already clear, and the roles are clear for each party. And I also want to emphasize on the complementarity, academic complementarity. It's very important to make sure that it's successful. So being the academic, but also working closely with the industry, knowing that what are we looking for when it comes to graduate outcomes, how are these graduate outcomes going to respond to the industry needs, and in terms of skills, but also in terms of solution-oriented graduates. Thank you.
Yes, solution-oriented graduates. What solutions? But if you can talk a bit, what types of solutions are you trying to bring on board through this particular project? And as you take the microphone again, we always think that coming together as a public and private partnership is not easy. Can you also unpack that and see how is it doable so that after this we maybe have also another project that is going to come and join these other two projects we are discussing on this panel? Over to you.
Okay. As I mentioned before, shared values is very important as one key point, and co-creation, co-design. If it's a joint program, it means that it's an eco-partnership. So you are working together towards something, and there are responsibilities of each party, and you have those shared interests. So either the industry itself that is looking for those solutions. So if I talk about solutions, the way our training design is done is we are and I'm sure we share this with the CMK, is developing a student who is creative and a problem solver. So, and the industry is looking for new investments, looking for development, is looking for growth. And growth cannot come without innovations. And so if you train a student to be innovative, to think on the challenges and how to critically think about challenges and providing solution, you have a workforce that is already prepared to be innovative at workplace. So the industry role here is to present the challenges they are having. Students will be working on projects either from here in Rwanda or from Finland, because they are where they are in an industrial space. So either way, it gives the skills of the students that whenever the graduate is coming back, he has that potential of contributing to the industry. So our partner industry, if I give an example, as Inyanje, we already work together and we already provide them with our students or our graduates, but we need to strengthen that innovative capacity or student preparedness for this. So with the collaboration with CMK, we see that model will help us also to strengthen our already existing collaboration and working together.
Thank you so much. As you just talked about Inyang, let me also build on that. Jean-Claude, Inyang as a private-led industry or organization, how are you contributing to this particular project? And how is it easy to work with the public, since you are more profit-oriented, more commercialized products that you work on? How do you make it doable in this context as well?
Yeah, thank you so much. Maybe before intervening, allow me to answer the previous question you asked on whether the food we ate was safe. Indeed, it was. And of course, from the human nutrition perspective, I want to let know everybody that a man is what he eats. So, and therefore, we ensure that whatever we are producing should be safe for becoming a good body-building material. Having said so, and coming to your question, if you look at our mission, although Inyanje is a business-oriented company, but we are not waving out the fact that we are to ensure that the well-being of our population is taken care of. And therefore, from that, we collaborate with public institutions to understand what are the needs of the population in terms of well-being so that we can effectively contribute. So it is not only in terms of food supply, but also food business becoming a source of income. Allow me to take an example of the milk value chain. If you look at the number of people who are currently involved in milk production, you will understand that we have a big role to play as we are pulling the chain so that from the farm level to the food processing factory, whoever is being involved is well taken care of. And therefore, everybody along the chain belongs to public institutions. Then whether we are it or not, we have to collaborate with them. So I don't know if I can take the same opportunity. How do we collaborate with academia? So academia and industry, this model, this triple helix model, I'm considering it as a relief for both industry and academia. Why? The academia is producing human capital. Industry, specifically in Nyange, we are producing food. So the food we are producing needs to be of high quality and safe. And the academia has to produce the high-skilled people that will be responding to the needs, not only for the industry itself, but the entire society. And therefore, this triple helix model will be driving the innovation. If you look at, let me be specific in our case as a country, if you look at the lifestyle that is currently here, well, there is a high demand of high quality products and safe as well. And therefore, we need well-skilled people to innovate, to meet the customer expectations. That is a must. Coming to us, of course, we need to also to innovate, to invest in research. And therefore, if I refer to one of the answers from the previous presenters who said that industry want to eat the fruit for which we do not contribute.
You agree with that or not?
Yeah, we are now investing in research to ensure that we get the innovative products which will meet our customer expectation and well-being of the population.
In fact, I was also going to build on that. Beyond offering internship positions, maybe in the industry, have you already started, as you said, you have already started also to spare some budget to invest in research and innovation? Or how do you contribute to that value chain in terms of research and innovation as a private-led entity? Is there any good example we can give? Because why I'm asking this, because some of the private sector companies also within the room, so we need to have this understanding of how private companies or private entities can contribute to research and innovation.
Of course, as my colleague here, Dr. Sylvie, said, we are in collaboration with academic institutions, whereby we are attracting the highly motivated students who are problem-solving oriented people, so that they come to us to discuss with us what are the problems in place, so that once they demonstrate their capability of being involved in finding solution, then it is obvious that we will, one, keep them, but also if we have a project that is really can help solve the problem that we have in order to make money. Remember, as you said, we are business-oriented. The money that we have to invest in research and development is from the sales. And therefore, that student who is capable and demonstrating his ability to solve the problem, it's obvious that he is forcing us indirectly to invest in him.
Yeah, thank you. Maybe we'll come to that as we discussed with Dr. Mina, also touching on the experience that of this public investment facility under the funding with the Finnish government in collaboration with the government of Rwanda, the emergence program or project, which is still ongoing. You touch about it and then also tell us what is expected in that project. And if you can also touch on that public-private partnership from your experience and also from the context of your country.
Yeah.
About you.
Thank you very much. Maybe I'll start from that last point about the public-private partnerships and the triple helix model. In my opinion, the successful RDI always requires triple helix. It always requires, public sector as an enabler for larger changes to happen. It requires the new knowledge and expertise that is produced by the academia, and it requires innovative companies who will then take this new knowledge to the...
Does it mean the triple? Is that what it means? The triple helix?
Yeah, I don't know. Well, to me, it means that, yeah. Yeah, but still, I think that you always, to be successful, you always need those actors. And of course, different societies have different kind of ways of working between public and private sectors, but like in Finland, like Dr. Jaakko here said, we have a very close collaboration with our public sector through the funding, for example, and we see that funding is an enabler for RDI, both in both sides, in academia and also in companies. So it is very good that we have this kind of a collaboration there. Although the funding is competitive, still it helps all of us, to find the best solutions to go to the markets and to help the society to grow. So then if I reflect this to our starting project here in Rwanda, we are at the phase of preparing the quite big project in the area of emergency management systems, and we are looking for the totally new perspective to build the paramedics expertise and education here in Rwanda, and together with the Rwandan universities and together with the Rwandan government, of course, the Ministry of Health and also the companies. And we are still in the progress of designing this project, but I think that the main requirement for the successful project in this context is that we understand the needs both in the public and private side, and we build up the kind of a trust where we know that we are aiming towards the shared goal here. And we understand the differences between the systems that, for example, we in Finland, we have an excellent EMS education and training system, but we understand that we cannot copy that to Rwanda because you have a totally different kind of environment here. So we have to co-create and co-innovate that together. And this kind of a process of co-creation, it requires public partners and private partners to participate. And what we can do as an academic partner, then we can bring the newest knowledge in there and help to see the different kind of pathways, how to build up this kind of a collaboration.
Mm-hmm. So building on that, how do you see this collaboration doable, especially building on the previous experience? What are the key driving factors of a successful collaboration between the public and private sectors?
Well, maybe I'm probably repeating myself already because you've already been listening to me in one panel, but I think that the key drivers for success are the mutual understanding of what we are heading towards, what's our goal, what do we want to achieve, and then working closely together, trying to find these kind of solutions that actually, are the kind of win-win situations where we both, all the stakeholders in the project benefit from that, from their own perspective. And then we create something bigger than just one organization, so that we all have our common interest in that. So I think that is to me at least, the biggest winning strategy in this kind of the project.
Good, thank you so much. Let me go to Dr. Jaakko again. Could you tell a bit about the future of this project, the Triple Helix? Where do you see this project in the next 5 years?
Yeah, we actually have several ongoing projects with Rwandan universities and also with the industry, and I'm very excited. I'm very happy if we can be part of the Rwandan growth story. This is quite an exceptional story as a nation, and there are so interesting factors that can be linked to this cooperation. If I think, for example, the company Inyane, they contribute so much for this society. I checked, sorry if I have a little bit outdated data, but the World Bank estimated in 2023 that 29% of the population in Rwanda get their livelihood from the agriculture. If we are able to produce high quality, world-class quality processed foods together as a result of this cooperation, as one example, it's a big thing for the whole society. And I mean, Inyane has good opportunities. We were lucky to visit. Thank you for bringing to your production site. Some of them are already world-class, like the milk powder factory. I would have not expected to see such a high-quality factory. But in other fields, if we are able to improve the value chain and the whole food system in Rwanda as a result of this cooperation, it affects the communities in the rural countryside, and it brings more income for those people who live in the countryside. So I'm very positive about this cooperation because things have been moving so smoothly, and also with our university partners, Catholic University of Rwanda, Rwanda Polytechnic, and Ines Ruhengeri, things have been moving so smoothly that I believe we will be able to create the triple helix cooperation between the industries and between the public sector and the academia here in Rwanda. And I'm looking forward for the effects, but definitely we want to see results. We are hungry for seeing the results of the cooperation, and we want to see growth and well-being, and we want to see that it reflects to the whole society, including the rural communities.
Correct. Thank you so much. I'm going to give an opportunity to the audience for 3 short questions, specific, 1 per person, to the panel, so that we are not selfish, but also reminding you that we are discussing about public-private partnerships in the education and also promoting research and innovation. Any insight from the audience? My previous panel said that they are giving us a chance to give you time. Otherwise, we are not forcing you to ask. Yes, I can see 1 there. Just 1 intervention, 1 question, and then any other comment, question. And you can also indicate which among the panelists we are trying to address the question. Over to you.
Well, it's not a question as such, it's just a comment.
Go ahead, yes.
When such a panel refers to this triple helix model, my comment is very simple. We forget sometimes that we are no longer navigating with the 3 helix model. Nowadays, if you want to be successful in producing innovation, disseminating it properly, we talk of a quintuple of 5 helix model or 5-leg table, because we include more and more, we include NGOs, and we include also the media. So when you are in the academia, sometimes we forget to include those 2 components. And in practice, when you retire from the academia like myself, you go to the ground, then you realize how influential, how very active, how are very efficient those NGOs who carry with them a bunch of innovation, dissemination, influence in society, and you also realize that media are very powerful. You may design any beautiful and smart product in the laboratory. You may do it with the private sector. But in the end, if the people don't get all the information about it through the media, or they get negative information, then you lose. So those are my comments.
Thank you.
Let's navigate a 5-leg table or a 5-helix model in addition to a Kowalski old triple helix model.
Thank you so much. Yeah, I think that's a good addition as well. So let's have former Vice Chancellor of Ines. Yeah. I know you have a very good voice. If you can start while they are bringing the microphone.
Industry. I just want to hear from the side of the Nordic leaders of universities. Should the government or policy makers be involved for the industry to really feel it is part and parcel of the growth of the human resources, or to come automatically? What do you think?
Thank you very much. So, anyone willing to answer to that?
Well, perhaps I can start. Yeah, there were good points about quadruple helix, and there are even more dimensions than for the. I have seen models with 5 or 6, but definitely the public sector is an important enabler in this public-private partnership, and as well in triple helix model. Often they are the ones who regulate in the country or jurisdiction, and they are the ones who have a public funding to finance things. And this is especially important for the universities. We tend to lack financing for doing the things which are necessary, and often universities concentrate on educating the young people or doing the research so that we could be competitive in publishing in international journals, for example. But I personally see it even more valuable if you can create value to your society, and if you can create well-being and growth in your economy. So that's it's important to do research, and it's important to publish, but without public funding being allocated towards the cooperation between universities and private sector, it doesn't bring as much added value for the society and the economy.
Mm-hmm. So maybe
in my opinion, I think that public sector is needed as an enabler, but not as the direction leader. So public sector should enable different kind of things to happen, but not to decide that this one is good and we all go to this direction, or this one is not good and we don't want to do anything on that. So I think this is related to, for example, situations that whether you want to make very strong or limited national strategic choices of the themes where you want to invest public funding. This can be dangerous if the markets and the private sector is not part of that process. So somehow I'd like to emphasize the role of public sector as an enabler in terms of funding, in terms of different kind of environment, enabling legislation and so on.
Yes. So you want to add a short comment? Also give your final message. What do you think this audience will take from this panel as well? So start thinking, maybe think about that question for everyone, but react to that.
Yeah, short question. This is not yet the final remarks, but I would think you need to start with the real industry challenges, bringing universities and companies together, and ensure public actors support the ecosystem. Then you will be successful.
Correct. So Bert, you wanted to say something on this?
Yeah, I just wanted to add on to what my colleagues have said, the role of private sector. Maybe we need to understand that it's the public sector is like a referee. We are players, industry and academia. Let me illustrate with what happened 2 months ago when people were producing unsafe alcoholic beverages. If there were no public sector in terms of putting aside those products, what do you think would have happened? So it's not only being enabling, but we also need to understand that we need to remain in the align with the policies of the country. So that's why the public sector is also needed so that we remain aligned with the government needs and the orientation, the vision of our mission, if I may say, that nobody is just investing in research and development, but coming up with something which may destroy the population. What do you think will happen? Thank you so much.
Thank you. I think we totally agree. We need to do research that is going to help the population rather than causing harm. Dr. Sylvie, what is your final remarks from this panel?
I think triple helix model is a continuous effort. We may start with a project, there is the excitement, but successful partnerships is continuous efforts and continuous mobilization of different projects, co-creation, innovation, not only innovation just for the students, but also institutional innovations on more frameworks, more working models. So it's a continuous commitment.
Correct, thank you. It's a continuous commitment. Dr. Yako?
Yeah.
Any final remark or we move?
Yeah, I think if we look at the societies in Northern Europe and we look at the societies in Africa and in Rwanda, automation and technology will be crucial for the development and the growth. Perhaps for different reasons. For Northern Europe, we have a declining aging population and we will not survive without it. For Rwanda, for example, it will be crucial for taking the next steps and becoming an industrialized powerhouse. So but it's important for both of us, and I think working together is crucial. Why we want to be present here in Africa, there's a growing population, there's a growing economy. We also want to learn how things work here, and we want to be present here so that we can work with you together in the future as well, when Europe is already, perhaps sad to say, but losing the importance of its importance little by little in the global economy. And this applies to all of the Western countries. We are lacking one factor, which is the population growth, and that is usually needed for the growth of the economy.
Yeah, thank you so much. Dr. Mina?
I think that in order to be successful in creating the kind of a society that enables growth and well-being to everybody, you need to have all the stakeholders doing these things together. And that's what we have been talking about today, and that's why we are also, building up the international collaboration, because we think that it's not just us who can change the world, we can do it together. And for us, it is really important that we get or are able to create the impact of the research and development that we are doing. And I think that can be done only in collaboration with different actors.
Bahati, any final remark as we close?
I think it is to thank you so much for this opportunity to make people to understand that this collaboration between academia and industry will help the country, which is believed to be a hub of education in Africa, that maybe within 5 years to come, we'll be having a big pool of well-skilled people with an increased employability, and also as industry having in place the products which will be diversity and meeting the customer expectations. Thank you so much.
Thank you so much. I think to summarize quickly, 3 points. One, the cooperation between the private and public sector was the central to this discussion. And then also collaboration between the North and the South need also to be more strengthened. I think more Europeans want to come to Africa. I think it's a good sign, and there is no borders. So you're most welcome to come and be part of the global economy, but also creating these opportunities for the young people to link both science and the practical aspect of what they study in the academia. I think that the linkage between the academia and the private sector, especially whoever is being trained at the universities is being trained for both the public and the private sector. So a very role from the private sector, very critical role has also to be played. But also remember that we're also thinking about the employment of these young people. And I think the private sector will also play a big role in this juncture. And also considering other actors, not only the triple helix, but also considering the civil society organization, the media, and other dynamics within the society. Join to thank the team and the panelists for their good contribution.
Thank you very much.
Give the floor back to the Master of Ceremony.
Thank you very much, Doctor, and thank you to our panelists for this panel that we just finished. And I hope everyone is feeling lively still. And as we continue, we're going to go straight to a presentation by Rwanda Global Health, and it's going to be presented by Vegard Landen, a Director of Access and Operations at Rwanda Global Health. You're welcome. A round of applause, please.
Thank you very much. Good afternoon, everyone. My name is Vegard Landen. I come from Rwanda Global Health, and I would like to start off my presentation today with a little bit of a challenge for all of you. Are we up for a challenge? Yes, great. So my challenge to all of you is, how long can you hold your breath? Can you do it longer than the person next to you? That's what we're going to test. So what I'm going to do now, I'm going to count down from 3, and then we'll all inhale, and we'll hold our breath for as long as possible. Okay? Perfect. So 3, 2, 1. Great. I will talk a little bit, but you guys just continue. I can see some of you are already starting to struggle a little bit. That's quite normal. We're going to try to keep this going for a minute. So you have 40 seconds left. Some of you are still in the game. And I will try to not talk too much the last seconds now, because I know you won't be able to really listen to what I'm saying if you're still in the game. 15 seconds to go. And the last 5 seconds. 3, 2, 1, finish. Raise a hand if you managed to do it. Okay, quite a few of you. Well done. So why are we doing this? For me, 1 minute is doable, but it's quite tough. 1 minute without air, quite difficult. And we chose to do it, right? Imagine if you're a newborn and you just come out to the world and you're not able to breathe. 1 minute is a long time, right? That is what we refer to as the golden minute. So if you have a baby that is born and is not breathing, you have 1 minute before you have to start doing interventions in order to maximize the life-saving chances for that baby. On conferences like this, we often talk about the big numbers, and the numbers I like to talk about is that globally, there's 2.3 million newborns dying every year. There's 300,000 mothers dying every year, and there's 30 million that dies due to time-critical emergencies. The vast majority of these deaths, they happen in low-resource settings, and the majority of them is preventable. So I would like to break these numbers down to one story that can help us put this into perspective and help us understand what it's all about, that we're breaking numbers into individual stories. And this is a story about a girl from Rwanda. So please play the video. And it would be great if we could have some sound on this as well. This always happens, doesn't it?
All by herself. She's learning a lot of things. This is Alia. This year, Alia learned to skip rope. She learned to brush her teeth. All by herself. She's learning a lot of new things. This year, Alia started preschool, but she almost didn't get this chance. Like nearly 1 million birds every year, Alia wasn't able to breathe on her own when she was born. But Alia was lucky. As part of helping mothers and baby survival programs, the midwife who supported her birth was trained in newborn resuscitation. She learned how to perform ventilation quickly and effectively within the first minute, known as the golden minute. After the training, the midwives continued to regularly those have frequency practice to keep their skills sharp.
When I saw the baby doesn't breathe, I began immediately resuscitation. And we have learned how it's important to help the baby in the first minute. I gave the baby ventilation with bag and mask. We had practiced it for this.
Every year, more than 3 million newborns die from birth complications. Globally, birth asphyxia is one of the leading causes of infant death. But it doesn't have to be.
Now, I've seen this movie probably 50 times by now, and I still get quite emotional when I see it. I feel this is what it's all about, what many of us are working on a day-to-day basis. So who am I? Who are we? I come from Rwanda Global Health, and Rwanda was actually established in the 1940s as a toy manufacturing company. And what people used to say is that there was 3 big toy manufacturing companies in Europe at that time. You had Lego from Denmark, you had Brio from Sweden, and you had Lørdal from Norway. Then in the 1960s, we transitioned from toy manufacturing to being a company that's all about helping save lives. And in 2010, we're a family-owned company, and what the family realized in 2010 is, if we want to be true to the mission of helping save lives, we need to also be working in the countries with the highest life-saving potential. And that is why Rwanda Global Health was established as a separate non-for-profit company in 2010, exclusively focusing on helping save lives of mothers and newborns. And what do? We focus on the systems. We focus on strengthening the healthcare systems. So the story that we just saw about a little girl, Alia, from Rwanda, that is an example of a system that worked, right? The midwife felt competent and confident and delivered the care needed to that baby to help save her lives, right? So that is what we are working on. And since 2010, pretty much all of the work we have been working on has gone into what we call the Safer Births Bundle of Care. It's an implementation program and a research program. It consists of 4 components, as you can see on the screen. One part is the training innovation. So that is physical products like, for example, a childbirth mannequin or a newborn mannequin that you can practice ventilation on. The other component is the clinical innovations. So that's medical devices. For example, this one. This is an upright resuscitator. Or this one, Penguin, which is a suction device. So you have the physical products, but that is being combined with two other components, and that's really the key of Safer Birth Bundle of Care, which is the sustainability component, which involves strong involvement of the Ministry of Health in the country where we work, and local adaptation, as well as local facilitator training. So we have something called SimBegin, with training the trainers, basically, in simulation. So that is core to the sustainability component. And then we also work on continuous quality improvement with the use of data, taking in the data both from the trainings and from the clinics, and then we use them for continuous improvement. So far, we have been implementing Safer Birth Bundle of Care at 150 facilities in Tanzania. That is where we started. We have also started implementation in other countries. In Tanzania, the results have been fantastic. So as you can see on the screen, we've achieved 40% reduction in newborn deaths and 75% reduction in maternal death. That's really astonishing numbers. I know there's quite a few researchers here in the room. These numbers were published in the New England Journal of Medicine last year. So if anyone would like to read the full article, send me a message and I'll be happy to share it with you. This is just as much as a research program as an implementation program. So there's more than 40 PhDs that's been working on the Safer Birth Bundle of Care, and it's resulted in more than 150 research papers that's all available through our websites. And this is a graph that I like to show when I talk about Safer Birth Bundle of Care, because I think it really shows what it's all about. This is the 7-day maternal death per 100,000 births at the first sites we implemented that in Tanzania. And as you can see, the numbers drops fairly rapidly. But equally important here, they stay down, right? So that shows that the sustainability component of the program is working. And that's the key here. So we're approaching national scale-up in Tanzania now. We have projects ongoing in Nigeria and also other countries, and there's a lot of interest for implementation of Safer Birth Bundle of Care. And Rwanda is one of the countries where we really believe Safer Birth Bundle of Care can be very successful. Part of that is that we've already been working here for some time on, together with the United Nations Population Fund and Midwifery Association and other partners, on training the midwives. And as we could hear this morning in one of the presentations, then Rwanda has increased from training 100 midwives per year to 1,000. So that's a massive increase, right? And it's so important that we make sure that the quality stays consistent and good when we do it. So that makes Safer Birth Bundle of Care super relevant. So earlier this year, in January, there was a delegation going from Rwanda to Safer Birth Bundle of Care in Tanzania, visiting the sites together with Global Financing Facility, which is a part of the World Bank, which is ready to help fund the implementation here in Rwanda. And I just got an email right before going on stage here today saying there's a concept note now being developed between the Ministry of Health and other partners, so that's fantastic. So, what we have been focusing on in Rwanda Global Health until now has been focusing on helping save lives at birth, so the lives of mothers and babies. What we see is that the components of a Safer Birth Bundle of Care, that's actually more of a methodology that can be applied quite universally. So if we take the component of the physical product, combine it with the continuous improvements and the sustainability component, that's a pretty heavy theory or a pretty heavy concept that we have proved works. So it's proven to work with mothers and babies. Let's bring that into other settings as well. So in collaboration with World Health Organization, we're bringing this methodology into their basic emergency care trainings with the goal of reducing mortality when it comes to time-critical emergencies. And World Health Organization has selected 5 countries where they will be starting rolling out this basic emergency care program, and Rwanda is one of them. So that is super exciting. Lastly, I would just like to emphasize the importance of partnership that has been, I feel, a key topic here today. And the key to our mission, so when I say our goal is to helping save lives, then we're not actually the ones saving their lives. Our partners do. We do our best to support our partners saving those lives. And it's all about creating these healthcare systems that's robust. So here in Tanzania, no, sorry, Rwanda, I would like to say a big thank you to UNFPA and to the Midwifery Association for collaboration that we've had throughout several years. I would like to say thank you to the Ministry of Health here in Rwanda for being very positive and opportunistic when it comes to implementing these programs here in Rwanda. And I would like to also say thank you to Norway for supporting Global Financing Facility with Safer Birth Bundle of Care and supporting World Health Organization. We're bringing basic emergency care to the world. So this is what it's all about. Together we can create healthcare systems that makes the healthcare workers in several settings be competent and confident, so we can see more stories like Alia and many more in the future. Thank you very much for your time.
Thank you very much for that great presentation, very heart-moving. We will now take a quick coffee break, and once again, the coffee break is 15 minutes. Let's be back after those 15 minutes so that we can continue and be on time, because we still have just a couple of panels left, and I believe that our panelists have a lot of information and knowledge to share with us, so let's not take time from what they would have to share with us. So we'll go for a quick coffee break. Remember that outside at the door there is a tourism pack or tourism guide, and for those who would still love to see Rwanda, you can go and get the information that you may need. And tomorrow we're going to go see we're going to go visit the Genocide Memorial Site in Gisozi. So have a quick break, everyone, and let's be back on time. Ladies and gentlemen, let's please come back to the room. Could everyone please, who is still outside of the door, outside of this room, come back to the room? Could everyone please come back to the room so that we can continue with the program of the day? Could everyone please come back to the room so that we can continue? Could everyone who is still outside of the door come back to the room so that we can continue with our program of the day? And may all those that are in the room go back to their seats, and then we can continue. Yeah, thank you everyone for your cooperation. I hope the coffee was good. And let us continue with our program of the day. And right now we have a presentation that is going to be followed by a panel. And this presentation is going to be presented by Prof. Ghislain Maurice Isabge and Miss Ingrid Julian Baskman from the University of Agder in Norway. And Prof, up to you. And you may introduce also the panelists that are going to be with you. Thank you, everyone.
Hello, everyone. Ladies and gentlemen, with all your respect, I first want to start by thanking you all for coming to the forum, but most especially to come for the discussion on esports. Quick question, anyone who has never played in life? No? Anyone who has never learned anything while playing? Someone? Yeah, well, then we are in a good discussion with a good group of people. Today, we want to discuss with you very briefly about esports and academic esports. My name is Maurice. I'm a professor at the University of Agder in multimedia, education technology, and game technologies. And I'm with a very capable lady here. Could you introduce yourself? Yes?
Is it now? Oh. Hi, my name is Ingrid. I am a first-year student at University of Agder, where I am taking my bachelor in academic esports.
Thank you. So the University of Agder is in Norway, obviously, the south of Norway. We have 2 campuses, and this is our beautiful campus in Grimstad. We claim this is the best campus you can have. You can protest, but you can't beat me because I'm also a member of the University of Rwanda. Thank you very much. So this is Grimstad. It's very beautiful. The university, as a university, was accredited in 2010, but it has a long history of starting as the colleges and so on. We have 2 campuses, 6 faculties of many different fields, as you may know, universities. We have also a special unit, which we call Teacher Education Unit, 23 departments, 24 centers, including one of the best Center of Artificial Intelligence Research and a Mechatronics Innovation Lab. So those are some of the best facilities we have. And our university owns a museum as well. I don't know if University of Rwanda does, but probably yes. We have about a population of 14,000 students. It doesn't vary too much because you see the numbers in 2024, it doesn't really vary too much. But especially we have 59% of our students are women and 41% are men, or boys if you will. We have also quite an acceptable budget of about 1.96 billion Norwegian kronos. You may help to put it in Rwandan francs. But we also have about 1,500 full-time employees, where majority are women. 55% are women and 45% are men. But now that you know a little bit about our university, I want to discuss with you, together with Ingrid, about esports and academic esports. The floor is yours.
Yes, thank you, Maurice. Okay, so first off, I wanted to start off, I think Maurice already asked it, but has anybody here ever played a game before? It can be console, PC, mobile, anything? Yes. Okay. So when I say the word esports, what comes to mind to you? I assume a lot of you think it's gaming. Some of you might not be knowing what the term is, or some of you might know it a lot. But esport is actually a lot more than just gaming. It is organized competitive gaming. It's also one of the fastest growing sectors in sports and entertainment. And big games, some of you might have heard of them, big games like League of Legends, Valorant, PUBG, Counter-Strike is also part of this esports. So it's not just about playing, it's about competition, community, and entertainment. Yes, so why do you think esport is growing? Can anybody maybe just shout out some words of why you might think? It can, I assume that some of you might think that it's things like it's fun. There's a big community that is shaping and growing. And maybe streaming as well. And that is true. Esport is very accessible now. It's global and social, and anyone can join it. And streaming platforms like YouTube and Twitch has also been a big part of helping esports go more global. And also it connects people socially across all borders. So esports isn't just about winning games, it's about identity, belonging, and community. So here is where UIA, or University of Agder, is unique. Because academic esports is about using, it's not only about using game for competition, but as tools for education, research, and innovation. When you play a game, do you think you're learning something? Yes, absolutely. You learn a lot of things, such as teamwork, strategy, communication, and a lot more things. And academic esports take those skills and studies them and tries to use them in the daily life. And students at the University of Agder, they learn about training, recovery, performance, technology, streaming and production, and a lot more. They explore how esports connect to society, culture, and even healthcare. So in short, academic esports is about understanding and shaping the digital society through gaming. So here's the difference between esports and academic esports. As I have already stated, esports is a competition, competition, tournaments, and entertainment, while academic esports is research, education, and innovation. So, for example, playing a game like FIFA is esports, but using or studying how FIFA can teach teamwork or digital literacy, that's academic esports. So it's not just about the playing, it's about learning and applying those skills and those lessons into real life. So, what are some skills that we learn through academic esports? The students at our university develop a wide range of skills such as teamwork and communication, leadership and problem solving, digital literacy and technical knowledge, and creativity and innovation. How many of you have had to work in a team project at school or at work? I assume many of you have done that, yes. And you know how challenging that can be. And in eSport, they teach these same skills, how to collaborate, how to lead, and how to solve problems under pressure. And these skills are transferable. They're useful in education, in jobs, and overall in everyday life. Personally, I've learned, and I am still learning as a first-year student, how to lead groups, design, and present internationally like I'm doing right now. And yes, these skills, they go far beyond gaming. They prepare us for the professional life. So, why does academic esports matter? It's because it connects gaming with education, technology, and society. It prepares students for future careers and innovation, and UIA, University of Agder, is proud to take a leading role in esports research and education. And if you'd like to explore UIA's programs, here are some QR codes for the Bachelor in Academic Esports and the Masters in Multimedia and Game Technologies. So thank you very much. I'll give it to you, Maurice.
Yes. Thank you, Ingrid. I hope everybody now has an idea of what you're talking about. But of course, just to emphasize and give you a very simple picture, how these skills we're talking about, they are transferable to the work environment. Yeah. First of all, in the game, you have strategic thinking, because if you don't do that, mostly you lose. Like when I'm playing with my 8-year-old boy, he beats me all the time, actually. So the same, you do that in a career as well. You need to have a business strategy, project planning, and so on. In sports, esports especially, you also learn about the data analysis. When you're counting the points you're getting, looking at the opponents are working and so on, you really need to have a good sense of data analysis just for the games. But also in work, you need to use analytics. For us as teachers especially, you also know about learning analytics. How do you follow up? How do you read the graphs especially? How do you make sense of visual representations of information? All that you learn without really realizing when you are playing digital games. Then you have teamwork and communication, as you mentioned. In fact, most very popular games, they're played across the globe. You may end up playing with somebody who doesn't even speak your language. So how do you manage? How do you compete? In the end, how do you agree on how the game should be? How do you understand the game rules? So that's really an important skill that you need for building a career. Well, the reason why we're here, and we worked with many people whom I very much appreciate, the University of Rwanda, the Rwanda Automobile Club, Ines Ruhengeri, Rwanda Polytechnic. We are trying to work with many people to develop competences in the end for economic growth through esports. What we are trying to achieve is to develop academic esports as a strategic vehicle for competence development, for youth employment, and economic transformation in Rwanda. We are going beyond entertainment. These pictures we took on Sunday, by the way. We were running a gaming rally at Petit Stade, where roughly we got more than 250 to 300 people, and we're trying to align with the Rwanda national priorities for digital transformation, where we are trying to work with the knowledge-based economic growth. So while these students were interacting like that, they could really understand many different systems from the IT perspective. As I mentioned, I have an 8-year-old son whom I feel I'm very blessed with. He's discussing with me about servers. The first time I had a server was probably towards the end of my bachelor, right? So these kids, and the grown-ups as well, we learn a lot through using these digital platforms very early on. We are looking at the global markets as well. Yeah, Rwanda is not disconnected. Africa is not disconnected. We need to think of how to make business out of this. It's projected, the global markets, it's valued at $5+ billion USD, and that's counting only the games, not counting the infrastructure behind the games, not counting about the computers and so on, the digital devices that people have to make and buy. We are talking about media rights and broadcasting. If you have to get rights to broadcast, for example, if you had one interested on Sunday, probably would have paid some money. We look at sponsorship and advertising. How many opportunities are created, because in these platforms, you have a global reach, usually. If you do really a proper game, you don't limit your possibilities only to one region or one country. We are looking at creative production. Of course, from those pictures itself, you see there's a lot of visual designs there. We see lights, we see different colors. That's done by people, and obviously, they should be paid. In fact, there's time we needed a designer of an animated video. I realized that the best one we found in Israel, they're charging about $20,000 for a 3-minute animated video. Imagine how much money people make out of making those products. Of course, we have also the events. If you organize the events, you sell tickets and so on, a lot of people can be really employed there, creating, mechanizing. I was getting some small stickers, for example, from local artists here. We're paying, I think, 700 Rwandan francs for a small sticker, smaller than this. Imagine if you sell 10,000 of them, how much money you've made already. And all it needs is just your creative mind. Then I want to share very briefly the experiences from our university and the Nordic countries generally. Year in, year out, we have this survey they call study barometer. Basically, they ask the student their experiences. So students report back, they feel the student well-being is enhanced. Why? Because they are allowed to have access to all these possibilities. We looked at academic performance also going up. Many students who looked up like, oh, they can't do much. When they are in their thing with the digital tools they are familiar with, then they are much better. They are likely to do much better. We talk about transferable skills development. I think this is a very good example. Who would have thought? I don't want to tell your age, but you did a really great job for a first-year student. How did you learn this? Yeah? She's always connected, by the way. She's really a good gamer. Yes. Then for the case of Rwanda, I would like to suggest for universities and polytechnics to make some good investment, start making esports programs within the academic program. I know the approval processes can be quite long, but it's always possible to start small and put some of the component into your existing courses and programs already. Tech startups, look into this area as a promising one. Youth centers as well, provide possibilities for the youth to come, experience, collaborate, and have fun after all. Of course, this comes with some challenges, which we have very much become aware as we run a gaming rally on Sunday. The first one is hardware accessibility. It's still challenging to get good hardware in country for such kind of applications. But again, we have several platforms. It can be a mobile device, it can be a standard PC, and of course, it can be very advanced equipment. I think it's more important to think about it, like intentionally start investing into that area. Infrastructure constraints, of course, internet is one of the key areas we need to work on. Skills gap, how many people know how, one, to design games, but also to arrange and manage events where people can meet and conduct things like LAN meetup, for example. Then cultural barriers. We think most people that I talk to, my family, my friends, when you say digital gaming, they think you more or less don't have much to do and so on. So why people have such a way of thinking about games? Because they really don't know the value it can bring. That's just one of the challenges. But the other challenge as well, how many games are run in a local language, for example, representing the Rwandan values, African values? Most games are borrowed from somewhere else. Then why would the people accept them? I think it's our responsibility to be able to also contribute towards games that are culturally acceptable. Yeah? There are some recommendations I would like to leave you with, to establish some pilot programs, as I mentioned, build public and private partnerships, as it was already mentioned. And here I want to thank one gentleman from an event organization company, for example. He supported us a lot, Christian. If you stand up, I want everybody to clap for that gentleman. He really served us with the Rwanda Automobile Club to run the competitions we wanted to run. And of course, we need to develop educator capacity. That's why we're running, thanks to the University of Rwanda and other institutions involved, a game design development workshop we conducted yesterday at CST, and we are very happy to continue to work in that direction. And to expand the infrastructure, that's a primary requirement. We want to focus on capturing high-value market segments, and that was in the stadium, as I mentioned. We want to empower the youth to feel confident, to communicate with others, but also to know, actually, we can do that. Many people, if you show them that picture, they will first ask, is this really in Rwanda? But I can tell you with the gentleman from the Rwanda Automobile Club, they have more than 12 devices like that. Most people don't even know it's there. So how do we do that? Well, we also need to look at strategic positioning. This area is generating a lot of opportunities in terms of jobs, especially, and people really can have fun while they do that. So I would like to really work with everyone on that field. This is, in my opinion, as a Rwandan, a sad picture. I pulled some statistics when I was coming, and it's comparing the esports revenues by market. I didn't want to show the whole world, but the blue points are Africa, while the black one are Europe. Yeah? So these are revenues in million USD. Until 2029, it's projected Africa will be only at 83.3 million, whereas Europe will be billions up there, almost 2 billions. Do you want that situation to remain the same or not? We also have some other infographics which shows on the maps where people are playing, where people are selling and creating games. This one also shows revenues per user by market. Again, the curve showing Africa is very flat. Do you want it to stay that way for the next 5, 10 years, or do we want to do something about it? I think that's a question that we should all be trying to answer, and through collaboration, I think it's possible. I would like to conclude by saying the time is now. I call everyone to make strategic investment in academic esports so that you can position Rwanda to capture the substantial values that come that field, addressing the critical skills development priorities for the digital economy. That was my son sitting there, by the way, playing with the other kid. They couldn't even speak. They didn't know each other, but I think they had a lot of fun. Thank you, Zahir, and the team for organizing the tournament. And you know, our leader, I want to really conclude by appreciating very much our tireless ambassador. Unfortunately, she had to leave a little bit early. She's really instrumental in this work being realized, and I invite you all really to join. You know, we need to support local game development. We need to support local competence development, and we'll be happy to be your partner on that. And I thank you very much for your attention. I'm not sure if I'm allowed, but maybe one question from the audience. 1 or 2 questions, suggestion? Yes?
When is the next game?
That's a good question, because actually it's asked by a member, the CEO of the ICT chamber. So I'd like to refer back the question to you, sir. And I give you the microphone.
No, I'm just curious because you organized this on the weekend, so I'm just wondering what Christia thinks would be the best time to have another game.
Okay. Christia, if you don't mind, could you please come? You're going to the stage anyhow. So I'll save you a few seconds.
Thank you. So I believe with Alex and yourself, we can even do next weekend. So that will be my answer. Thank you.
Thank you. The next question goes to the same question to my boss. When should we have the next gaming, Larissa?
I concur with Christia. Let it be next weekend. Thank you.
A big round of applause to our Vice Chancellor. Thank you. I would like to invite our panelists, because we have a panel next, or if the MC allows.
Excuse me as I get the names of our panelists. Yes, and for the next panel, I am going to welcome Mr. Zahir Mohammed of the Multimedia and Game Technologies in University of Agder, Norway. I will also invite Engineer Rita Clemence Mutawazi, Principal at the Rwanda Polytechnic Tumba College. I will also invite Mr. Christian Gakwaya, President of the Rwanda Automobile Club and first Vice President of the National Olympic and Sports Committee. I will also invite Prof. Florian Tsanganwimana, Principal at the College of Education at the University of Rwanda. I would also like to invite Mr. Munyenhwari Clement, Director of ICT at Ines Ruhengeri. And also invite Mr. Nhare Alex, CEO at Rwanda ICT Chamber. A round of applause for our panelists, please. And over to you, Dr.
It seems I have to change a little bit. Oh, thank you very much. I would like to really thank very much the board of our panelists for accepting to engage in this discussion. As I mentioned, we are addressing the theme of investing in the academic esports as a strategic pathway to future-ready skills and development. I want you to go home with the main three words: skills development and future-ready employment. And I would like to start with a question to my friend here, Zahir. Zahir has, I think he's the only one in this room who has already completed a bachelor program in esports, academic esports, and now taking a master's in multimedia and game technologies. So can you share your experience? Why did you choose that study line, and how was your experience over the next 4 years?
Yeah, of course. So initially, I looked at continuing studying after my previous bachelor, and oddly enough, I saw academic esports in Norway, and I looked at this and I was like, this is stupid, why would I want to study this? And my mom actually was the one that read through the course description and said, give it another go, read it and see what you think. And I read through it again and I realized that it's actually quite more in-depth than just gaming. So I applied, got into it, moved to Norway, reset my whole life from South Africa. And honestly, I think it was one of the best decisions I've made, because the study itself, albeit pretty new in the world, it gave me a lot of opportunities and opportunities to develop my skills. Because as Ingrid and Maurice mentioned earlier, the idea of academic esports is to create that intersection of your transferable skills. So a lot of gamers have a lot of skills that they don't realize they have. And the idea is to create that active thinking about it. And as I went through the study program, I realized that me playing these games and running my teams or leading assaults in the games I'm playing, I'm actually into this project management / event management industry. And when I started to realize that, I started to actually pursue that and try and take on event and project management. And I realized that there's a distinct connection between gaming and the skills you gain from it and the transferability to the work life. So that's my experience so far. And now I'm taking the master's, hoping to further develop the world of academic esports.
Thank you, Zahir. There's one secret he didn't tell. Actually, as of yesterday, we found out he could do a PhD in the same field in Finland. So it's not a very disconnected area, to say the least. So let's talk about the strategic value. And my question I would like to direct to the principal, Professor Florian. What role can academic and competitive esports realistically play in Rwanda's national skills strategy, digital economy ambitions, and youth employment agenda?
Thank you, Maurice, for the question, and good afternoon, everyone here. Yes, we have learned a lot from the presentation that Maurice and Ingrid made to us. And I think if you have followed very well, you realized the potential of esport first, and of course, what it means when it applies to education or learning, if I can say. So what we have to do as part of integrating so that we can reap from its benefit, we first need to first realize that there is the potential, a market there, and which can help our graduates, those who may have a chance to learn, to access to job opportunities, or themselves even create them. So my understanding on how we can reap from it as far as education is concerned is to establish programs that train our students in the same area of specialization, or provide opportunities for short courses, especially for those who are doing general computer science or programming courses, so that they can orient their specialization to e-sport. And of course, as far as teaching and learning is concerned, you have seen that integration of e-sport into the teaching and learning process is a means to train transferable skills, those we commonly call soft skills, collaboration, teamwork, communication, decision making, and all other skills that are needed by employers. Last, as I reflect on the importance of academic e-sport especially, is that we have all been learners, and we know that learning is not an easy task, and sometimes it generates stress. But at the same time, learning becomes easier when it is enjoyable. So in education, learning through play and getting immediate reward is something that is recommended so that we can avoid the stress, which of course encroach on the well-being of learners, at the same time promoting deep and effective learning. So I tend to be talkative, but let me stop by here. Thank you.
Thank you, Prof. Of course, we can achieve many things, but without investment, almost nothing happens. I learned from a good old professor that before you do any project, you need to make budgets and find money. So my next question goes to our dear Alex about investment priorities. Where should public and private investment be targeted first? Game development, infrastructure, education, creating esports leagues, or content production to maximize economic return? How do we start? How do we attack this problem?
Thank you very much. I think one is to mapping out what we already have. Sometimes when these new trends come, they seem to be completely new, as if we've not been doing these things before. But when you realize that the same computer-aided manufacturing or computer-aided design tools that are used in gaming are also being taught to the students in one way or another, whether it's architecture students or other students in mechanical engineers and so on. You realize that actually there's already investments that are going into this space that could be leveraged. So I would argue that one is understanding what we have and then trying to see how do we link it with the direction that we want to go into. And infrastructure is one of them. So the infrastructure, sure the colleagues that are here from University of Rwanda, there's high performance computer. There's computational capacity that is there. There's internet and broadband or bandwidth that is needed. And as you put it earlier, that most of these players, they want to do, they want to play with colleagues that are somewhere around the world or even just within the same country. But most of the time they are slowed down because of this kind of connectivity, digital infrastructure that is required. So when we realize the potential which you've just demonstrated, that one, this is a highly growing industry. It has multiple opportunities because it's because of its capabilities, the multiple capabilities that it brings. It brings the creatives, it brings the engineers, it brings the organizers, it brings so many dimensions of potential that it unlocks. Yeah, then we want to put resources there, and the resources are existing. You did the competition in Stade, right, or at Petit Stade. That is infrastructure that is there. Now, where we need to put a little bit of more effort is on mindset shift. Because for a long time, most of this has been seen, most of the esports industry has been seen as time wasting. We have not done a good job in relating and connecting it to the actual industry. If I hire a gamer, how is that person going to connect in my company? Or do they have to come and do gaming? No. So these people are doing all these multiple disciplines across the value chain, the esports value chain. So my argument is, first of all, map out where we want to go, the direction we want to go in, which you've given us. Two, see what resources do we have, what don't we have that we can add on some of the, especially the infrastructure needs. Three, mindset shift towards curriculum development and alignment. So in academics, I'm sure there are so many other areas you could use that you could bring together, where even at the young age, I've met young boys that are telling me they are trillionaires because they play Roblox. Roblox is one of the most popular games online. Okay, but they are trillionaires. And how do we now bring that knowledge and connect it to economics, connect it to finance, connect it to, so that they don't look at it as a time wasting, or even the parents themselves don't look at these as time wasting, but they look at it as an investment in knowledge, in skills that this kid may not have been interested in to explore, because first and foremost, as a parent, I think they're wasting time. So I think that's where we need to start, appreciating its potential and then pursuing it.
Thank you very much. I'm glad you mentioned the Roblox, because apparently I'm addicted to it and I spend a lot of money on skins, just small drawings, and you pay dollars for it. How about we make skins in Rwanda and make money? Well, we need education again. So my next point will address education integration. And I would like to address this to the principal of Tumba College. How can esports be formally integrated into secondary and tertiary education in ways that ensure academic quality, health, and employability outcomes? I want to be a little bit specific here. The academic quality we are talking about, most people, when they think about esports and gaming, it's just playing and wasting time. So where is the academic quality? And most people think if you're a gamer, you just sit there and not be fit and get sick and so on. How about the health? Then in the end, the employability outcomes. Where do we start with the education integration?
Thank you. Good afternoon. Maybe I would have to mention that College of Tumba is part of Rwanda Polytechnic, of its 8 colleges. And I'm going to share what we are doing at Rwanda Polytechnic in terms of integrating gaming and e-sport in our teaching and learning. So we have, I think we were quite strategic. We started earlier. We have a short course of 9 months where people are taught gaming through digital multimedia production program, and it has been there. You will be surprised to know that we have graduated a quite number of the youth, and in most of the time, as my colleague says, we have young people. There are those young ones that in most of the cases are just graduate from university, or they don't even want to continue the university, but they see their skills and their passion in e-sport. We have graduated 360 graduates, and around 78.9, around 8%, they have secured jobs. Most of them, they are into startups, and they are, it has been a growing area, and we were glad that when we had the e-sport and gaming, some of them came to demonstrate what they have developed in terms of the games that sometimes focuses even on the cultural part that Maurice was talking about, that also takes into account the global perspective, as they are not only targeting the local market, but they are designing for the global market. Besides that, also, we are trying to renovate, to renew our curricula, especially the information technology curriculum, where we are, in the review we are currently doing, the gaming and the e-sport will have a special kind of plan. They will be doing game design and planning, where students learn to draft the game from scratch, and they utilize different techniques. They will also tackle on industry standards engine. I'm very sure that Zahir knows much more of what I'm talking about. They will also do immersive production, where they will cover the generation of 3D environment. They will also run on optimization and performance as the one that I'm fan of, the deployment and monetization. How do you get money from the gaming industry? So we are trying to make sure that the youth, they won't just run the traditional way, the IT, the networking only, the hardware part, but also we are targeting it as a future skill need, where they will see their niche if they want to do the gaming and the e-sport in those parts. I'm not so sure if I'm the right person to talk about the health part, but I will just say that maybe I'll share my perspective as a parent. Whenever I see my daughters very focused, even the younger one who is 2 years, I always know that they are on gaming. They are doing some games. So if I pass by 2 times and I see you, you are so much focused, you are not getting out, you can't even hear me calling, I tell you, please, what is that game? I don't know the name you mentioned, but my daughter is, one of them is fan of that one. Yes. And she always tells me, she says, you know, Mom, I can make money out of this. So I tell them to remember that sitting for more than 2 hours is actually same as drinking or having cigarettes, and that's when they get attention. So it's we have to combine. We have to be sure that the element of health is included, because from just as a user or as a parent, I see there is a tendency of addiction and forgetting everything, and we have to be aware. Maybe while we are even designing, how do we make sure that parents and the audience, especially in the local context, the culture, we are not seeing those kids that have that passion, or even the students who are doing that as losers, or as just people who are not, how do I say, abanebwe. The actual word in Chinyarwanda is like they don't want to do anything else but game. So
good news.
Yes.
Good news, because it's documented. Professional gamers actually exercise as much as any other pro athletes, because you cannot have that high level of concentration if you're not physically fit. Yes. That's also known. Well, now I have my colleague here, if I may jump really quick. We are talking about games, we are talking about work. So I want to address industry pathways. And my question goes to Christian. What concrete career pathways can esports ecosystems open for Rwandan youth beyond professional players? What are the other possibilities that could be out there beyond professional players?
Thank you. Thanks, Maurice. I'll probably start by borrowing from what Alex said. For us to be able to understand e-sport as a pathway or as an ecosystem, there is a need of a mindset shift. Because as Rita just said, we still, I don't know if it's related to the Kinyarwanda word, gukina, playing, it means something unserious. It's a relaxation. So as long as we still consider it as playing, I don't think we'll be able to even really see it as a pathway. Esport is an industry, it's an ecosystem. It's one of the most promising and growing industries. Earlier you mentioned about 5 billion just on the console, on the game, but if you consider the entire ecosystem, it's a multi-billion industry. And when you talk about a multi-billion industry, you're talking about millions and millions of jobs that can be created in that sector. So how it can be a pathway to jobs, to employment, to also make sure that it's a positive addiction. I will use the word addiction because that's what people keep referring to. It's not addiction. It can become a passion if you go in the positive way. So the mindset shift, we need to decompose the whole esport ecosystem. So there is the gamer who's at the core of the industry, who's playing on the console. But there is a game that gamer is playing. So there is someone who's developed the game. There is an animator who did the animation, you mentioned about the video. There is someone who did voiceover. There is someone who did translation for multiple languages. There is someone who did marketing. There is someone who did research, statistics, analytics, media, many, even monetization, you talked about it. So there are people who are now seated saying, okay, if we put out this game, how many people are going to download this game? If they pay $2 and they pay in one economy and this, they do those projections. So to me, I think we make a step back. I'm especially talking on the continental context, and stop thinking about esport as just as an entertainment or as something for people who are lazy to do what they should be doing, and really consider it as a serious and a promising sector, and go into each subsector of that sector. So connect it to media, connect it to technology, Alex mentioned, to the creative world, and make sure that each subsector is defined correctly. Now that links to the education part. Someone becomes an expert into multimedia related to games. Someone becomes an expert, a developer. My friend Alex knows very well. Last year we wanted to host a gamer's garage, a developer's garage. We couldn't do it, but I believe we'll still do it one day, where we needed to bring people. Yes. So where we can bring people to say, okay, we need 50 people to develop games in the local language or in the regional language, so that if we have 50 games developed in the local context with the local culture, they can even respond to the worries of the parents that are saying, okay, I don't want my kid, I don't know what they're playing, I don't know what they're being taught through that gaming. But now coming back to your question, connecting all those subsectors, we create a whole economy, and we create multiple, and to me it's unlimited possibilities of employment. My last comment, esport, now coming back again to the context of the continent, I think it's one of the sectors where Africa or Rwanda is on the same level of advantage as any other continent. Because if we take some sectors, we say, okay, this is quite advanced in this country or in this part of the world, we can't catch them, or we have to use so much energy to catch them. But a game developer based here can be the same as a game developer based in one of the most developed countries in esport. So we need to leverage on the sector. We need to understand the number of opportunities that are there, and really do it intentionally. Being the education, being the investment, then we can win bigger.
Thank you. Thank you so much. Obviously, this is an interesting topic, and I'm very glad you are taking it now. We can take much more time, obviously, after this panel. And there are many issues that we need to think of, the policy frameworks, the regulations, and so on. But in the interest of collaboration and sharing, maybe if you allow, we can take one or two questions from the audience or comments. Yes, one. Anyone? Any comments, any suggestions?
If not, I can jump in.
Yes.
I'll take the time. I agree with what you said about the mindset shift. We usually refer to it as creating awareness of what esports actually is. And we usually refer to it as creating awareness of what esports actually is. Maurice earlier mentioned a $5 billion industry. I'd just like to point out a small discrepancy. The esports industry is going to be valued at almost $6 billion by the end of this year. But the gaming industry as a whole is estimated to be valued at about $500 billion by the end of the year. That's $500 billion. And I think people are unaware of the differences between just competitive gaming versus what the gaming industry truly is. As you mentioned, the event side, the multimedia, broadcasting, advertising, business, etc. The list goes on. And I like to compare it to the IT industry. When the IT industry first started, there was a lot of skepticism about how is it going to progress. People didn't want to jump on it because they were worried about it failing or it being a new thing that people aren't sure of. And look at where the IT industry ended. And esports is showing that same similar growth. And as you said, Rwanda is in a good position to develop it because right now it's a hub for conferences and events. Why not use that situation to further develop and allow opportunities for the youth to either start up, say, gaming cafes, teams, game development companies, maybe streaming or content creation platforms, and in turn that will exceed and blow up into its own industry in Rwanda.
Thank you, Zahir. I think that was a very good conclusion. Thank you very much. Oh, okay. The one question we are given? Okay.
Thank you so much. That's a very interesting topic there. Now, when it comes to esports, you find in academics we come about the idea of game theory, right? And since he has been a student in that whole domain, maybe you can tell us how it relates to game theory. You see, like business, there's a lot of strategy. Organizations are using game theory in coming up with tactics and so forth. Maybe if you can shed light on that, and then now we see how it fits in the broader business ecosystem, right?
Of course.
Yep.
So, as I mentioned earlier, transferable skills, right?
Yep.
So within games, you have games where you do focus on these types of skills, whether it's business management, leadership. You have games where you have to build a sort of industry or a type of empire, things like that. And these transferable skills are what allow you to do that. And you mentioned game theory, right? So game theory and esports tie hand in hand because you learn how to work with these gaming skills. You also learn how to use them in the real world. And there's an overlap between them. So looking at, as I mentioned, the gaming examples, that's where the overlap is.
Unfortunately, that's all the time you have.
It's one more.
Oh, well, okay, one more? Yes, somebody has a microphone there.
Thank you. My name is Irene. I have a question. From the discussions, I can tell the education sector is first-hand benefiting from the esports industry. But as an employer of today, we are facing a huge undermined challenge where all these young people are self-employed right now. Most of them are running to be employed by YouTube, by these games. So while the panel was going on, I thought to myself, how can an employer of today incorporate this industry? And you can look at it in any way. Maybe one way is to motivate the employees or to gain a skill out of it, or even to earn revenue out of it. I don't know, any of you can answer me.
May I ask?
Yes, please.
What sector are you in?
Any sector, any sector.
I ask
Yeah.
for a purpose because in many industries outside, let me say outside, in the developed country, you find that they have simulations. So whether it's a simulated trading engine for investments to learn to learn finance, that simulates what actually is closer to what is happening in the real world. When you come to games, there are several ways that they build what you could classify as game mechanics, that you can simulate a lot of the experiences, mostly for us who who have very limited employers, so for people to gain, to have experience, so that by the time they come to you, they actually have skills. So my recommendation would be exploring collaborations to build maybe a game that simulates the skills that you will need that person to come to the job knowing. The reason most of us use Microsoft Word and all these other different tools is because we get conditioned while at school to use these tools. So when we come to the labor market, we are actually, those are the tools we know. Not that there are no substitutes for them, but it's because we have adopted them while we are at school. So if there is even a potential for collaborating, for working together, and the schools that are building, the universities that are building these games, and the entrepreneurs that are working, maybe not the entrepreneurs, the students and everyone, the developers that are there, to work together. I'm saying this actually because we're working on something. I have a team that I'm mentoring who are working on something in the area of e-commerce, but simulating e-commerce so that a kid who is still at school can learn how does actually e-commerce work, and the same way Roblox has Grow a Garden, yeah, and they get to learn and to know the concepts. So that's where I would go. But yes, it's complicated to employ these people. It's hard.
Thank you, and thank you for affirming that. So maybe from other panelists, especially look at a human resource, because right now I could be an employer, but I've risen ranks where I was once a human resource manager, and during the day, you have a team that is struggling to concentrate. But as soon as it clocks 5:30, they stay in office until 10 o'clock playing games. And it could not make sense. I thought your brain was tired, you know? So, and then I think that, okay, how can I, by the way, even if it's a team building thing, can I give you a day in a month to go and on a beach somewhere and you set up your projectors and play your games, as long as it is going to help me? Should I incorporate it as part of, I don't know. I just need to hear from you. Thank you.
My very quick answer, next to my office, like 3 doors, there are dancing machines. I think they call them Dance Mania. You find we professors fighting to go there to dance. 10 a.m., 2 p.m., doesn't matter. You get bored with your work, you go play a little bit. We have an arcade room as well. You refresh, go back to business. That's one possibility. But also another possibility, as many colleagues have mentioned, you need to look at games which go in line probably with the business you're doing. That could also help. I told about my son who's discussing about servers, for example. All these are skills that they develop. So if your employees are playing such games, maybe a keyboard is disconnected or something, they already know what's going on. Then they'll fix it themselves, and that will save you some money, I think, and time. Well, there's a lot to discuss. I think it's very interesting. But if you allow me, I want to ask, because games are also about inclusion. Gender equality, everybody is included. So if you allow me, give me the honor to ask our dear Rita from RP Tumba to give just 2 words closing remark.
Yes, thank you. I think we need shifting our mind, as they were saying. Gaming and esports have a lot of opportunities. Just as you concluded, maybe I wouldn't have some female student wanting to play basketball and football in real actual playgrounds, but I find them playing games. So it's even a way of gender inclusion and equal opportunities. You will be surprised, I'm addressing to someone who asked that question, that even in our culture in Rwanda, gaming was one of the tools to teach people soft skills. Those who did Itorero, you know how we will learn collaboration in terms of gaming and in terms of other skills. So it's good that we shift our minds on how do we even actually see the workplace and include also those games, even if we are not teaching, it's a workplace, have those fun time and games there. Of course, at my college, I'm looking at the arcade and other stuff to attract the youth to choose the college. And I'm very sure that in terms of academics, we are going to develop more programs to make sure that the youth, the 60% choose technical skills just because we are innovative and we are looking at future skills as a part of our strategy. Thank you.
Yes, please give a round of applause to our panelists.
Good evening, everyone. I will be introducing the next panel from here as I have the honor of moderating it. And it's going to be the last panel of today, and it's going to be a quick and short one. But thank you to the last panelists and to the moderator. This was actually quite an interesting panel. I now want to get into gaming, but so on to our last panel of the day. I would like to introduce the panel, and the title of the panel is Digital Transformation and STEM Education Solutions. And on this panel, I will be joined by Mr. Leon Habomvura from the University of Rwanda. A round of applause for our panelists, please. And I would also like to invite Salvador Cabeza de Vaca from KTH University. And lastly, I would like to invite Dr. Jennifer Batamuriza, Head of Data-Driven Incubation Hub at the University of Rwanda. And as Jennifer is getting here, I thought that if I were to introduce them, I don't think I would be fair enough to introduce them how they would really be introduced. So we're going to do a quick round, 1 minute round of everyone introducing them and themselves and saying who they are. Starting with you.
Thank you very much. I'm Leon Habomvura. I'm a instructional designer from the University of Rwanda and from the Center for Open Distance and E-Learning, a center which is mandated to promote the use of technology in teaching, learning, and research. Apart from that, I have been acting as a local digital pedagogy coordinator in HEPTED project in partnership with Finnish universities and the Rwanda Polytechnic and University of Rwanda. Thank you.
Thank you.
Hello, everyone. Good afternoon, and thank you for staying until the end. It's a long day, but I hope you find this discussion that we'll have stimulating. I'm Salvador. I'm from Mexico. I have a bachelor's degree in chemical engineering, and I'm studying my master's at KTH in sustainable energy engineering with a focus in energy in buildings and cities. And I'm here because me and my group of classmates, colleagues, and friends, we worked in a project on modernizing the Nyarugenge district here in Kigali, and we hope that you can find it interesting and have some discussion with us afterwards.
Yes, so hi everyone, I'm Jennifer Batamuliza. I'm from the University of Rwanda. I'm a lecturer. I teach technology courses at undergraduate level, and I teach data science courses at master's level. And I work as the head of Data-Driven Incubation Hub at the University of Rwanda. Maybe I'll get more time to talk about that. And also holding different positions at the University of Rwanda. So I'm happy to be here and learn and also share what I can share. I know I've gained a lot from previous speakers and panelists. Thank you.
Thank you. Such a diverse and yet interconnected panel we have here. So my first question goes to each one of you here. And my question is, what is your understanding of digital transformation and STEM education solutions? And how does it transform into concrete actions from your organization's perspective? Starting with you, Mr. Leo.
Okay, yeah, thank you very much. Yeah, I'll appreciate the question about how do I understand digital transformation in STEM education. From my perspective, digital transformation goes beyond integrating digital tools in education. Rather, think again, reshaping how education, teaching and learning may happen, integrating digital tools in teaching for promoting the problem solving and decision-making skills to learners, and expanding the skills to the graduates to be able to solve some local problems using broader skills based on availability of resources on internet or online. So apart from that, at the University of Rwanda, the digital transformation is driving so many things in our education. One, University of Rwanda is a blended university, and from this we are trying to upgrade from blended university delivery mode to by developing some online programs which might have much more part to be covered online. Apart from that, we, in partnership with various partners like universities from Finland, we were able to train what we call digital champions. More than 30 people have been trained from University of Rwanda and the Rwanda Polytechnics. And the main purpose behind was shifting from teacher-centered instruction to learner-centered experiences. And that partnership of promoting and enhancing the human capacity to drive these, incorporating technology just as not only tools, rather as enabler and supporting the graduates to become broader competitors for the local market and international markets. That was very important. Apart from that, through digital transformation, especially in STEM education, we are able to scale up our programs. We know that sometimes the infrastructures are limited to accommodate a certain number of learners, but by incorporating technologies, we know that we can even go beyond the boundaries of four corners of the rooms. So technologies, for sure, nowadays is promoting the education, not only supporting the institutions, rather helping the quality of education, even producing the quality graduates. So we have the learning management systems, we are promoting the use of multimedia, learning materials. All of those are enhancing the capability to acquire a certain number of students to acquire STEM education programs at the University of Rwanda. Thank you.
Thank you very much, Mr. Leo. If we could.
Thank you, Leon, for your answer. I think you touched on a lot of key aspects. I'd like to develop a bit more on the tools. I think for digital transformation, using simulation tools can change the approach that people have to problem solving. Like, we're used to doing some more like static designs where you come up with, I don't know, the boundaries initially, and then you start building from there. But I think with new modeling tools, these boundaries can be more flexible. Like they can adapt in real time. For example, you can get some real-time measuring of traffic jams or of waste disposal in a landfill. Situations like this where, I don't know, we measured like building consumption for energy in our project. And I think it really reflects how the way of thinking is changing from, a bit more rigid to more flexible and open to change. And I think also like a key aspect of digital transformation in STEM education is to, as Leon mentioned, to open the people's minds, to think outside the box, to come up with different approaches to maybe some existing problems or some new problems that have never been dealt with. and get opportunity out of them. So yeah, that's what I think.
Okay, so thank you. A lot have been said by my colleagues. As I said, I'm from the University of Rwanda, and I know the University of Rwanda is now moving to what they call it's digital by default. So whether in STEM or any other field. But now we're talking about digital transformation in STEM. I can say that digital transformation starts with let's say education platforms like learning platforms, or let me talk of digital technologies in general. And as my colleague was saying, a lot has been done at the university. And I remember even during COVID, it was hard to make people understand that they have to teach online. People are like trying to resist because change is hard, as we all know. And they had to maybe talk to the people, and it's like mindset shift, as they were talking in previous conversations, like for people to understand how important it is. So it wasn't just for COVID time, but even up to now and even in the future, like you can't run away from technology. And now everything you do, it's tech. So it's now enabling different fields, be it in education, in all these different sectors. Apart from digital technologies, let's talk also about data. So, which is very, very much important, especially in helping in informed decision making. And I can also talk about like innovative teaching and learning. So with digital transformation, like it helps this teaching to happen innovatively, let's say by project-based learning, like moving away from passive teaching where there is no more interaction, but then moving to project-based learning where both students and the learners and the teachers are both involved. And also talking about building all these platforms. These platforms, for sure, they make learning easier, especially when there is use of simulation. They were talking about simulating, like you don't have to have the hard devices. Like if there is lack of maybe enough infrastructure or devices or tools, there is simulation. So you can simulate and it looks like it's in real world. And also about virtual lab, virtual STEM lab, which is also very, very much key. So all these contribute to digital transformation, especially in STEM. And then for learning tools, we can also talk about like AI, like making people to understand, or students to understand that, I mean, AI is there to help them be efficient. It's there to help them bring out quality work and all that. So there is AI, there is simulation, there is virtual STEM labs, and all that. Maybe we'll get to talk more later. Thank you.
Thank you very much, everyone. Quite interesting answers, and I agree with all of them. But for another question, since we all have really great things to say about digital transformation and solutions in STEM education, what would be your advice for the future and newcomers who want to start implementation or are seeking cooperation partners in this area? Yes, we can start with you, Jennifer, Doctor.
Yes, thank you. What I can say is that, first of all, it's about aligning with the industry, or aligning with industry, aligning with the needs of the people. Because we know that, like when we talk about technology, let's also talk about the people, because if you make a technology that will not help people, then at the end of the day, that will not bring any change. So it's about aligning and knowing the problems which are there so that they can solve the real world problems. I think that's a very, very important thing I can say. And then I can also talk about starting small and going big. So here I mean they can start by piloting, like having different projects, pilot them, small ones, and then afterwards it can be scaled up into bigger projects. Another thing I can say is about partnership. So I know partnership is very, very much key. I know this has been people have been saying about this again and again. When we partner with different people, they can bring what we don't have. For example, bringing in the maybe technology, infrastructure that we don't have. They can bring in expertise. They can bring in all that. So it's very, very important to partner with people. He talked about the University of Rwanda, how we are having like different infrastructure, like we have the high performance computer, which helps in computation. And here, if we get to partner with people from the industry, then they can benefit from that. Even right now, we are working with RISA, and they are using the HPC at the university. So these are ways that we can start, like just starting by partnering with different people. And another thing is about capacity building. Maybe I cannot stop without saying that. Sometimes we put more efforts in tools, technology, and all that, but then when it's there, you find that people lack the skills to operate those different devices. So it's really important to train the people, building capacity of the people who are going to use that technology. So that's my advice to the people who want to start that. Thank you.
Thank you. And you, Mr. Salvador?
Yeah, I have two trains of thought. One is more like advice, like at an institutional level, and the other one is on a more like individual level. I'll start with the institutional. I think institutions should encourage like multidisciplinary context. Like here, for example, in my program at KTH, there's like people from many different backgrounds. We have like a lot of mechanical engineers, some chemical engineers, we even have some marine engineers, some people that have never done engineering, some people that did finance or economics. And I think when you associate yourself with people from different backgrounds, you find many different pieces of the puzzle that each one of you can bring to the table. And if you work with them and open yourself to getting to know them, you end up with a very nice team, like I did. And you can really like aim very high. I agree, it's necessary to like start small. Like maybe you have some project for like some vision for, I don't know, like a city, but then you can start maybe with one district or maybe with one neighborhood and then build upon it. And then as to more like individual level, I think, I don't know, just trusting yourself, but as they say, like eyes in the sky, but feet on the ground. Don't lose yourself in the illusion, but also like don't hold yourself in a cage, because I think we're all capable of doing a lot if we put our minds and work hard for it.
Yeah, thank you. When it comes to new partners or partnership, I have two concerns. First, let's align with the existing plans. And whenever you come to partner with a certain institution, maybe they have their plans. You can come up to improve, to support, to contextualize what is coming as new, because you are not starting from scratch. Recently, I was lucky to be in Finland, in Helsinki, in the Global Partnership Forum. And when I was presenting the digital transformation baseline of Rwanda, but at the end, one came to me, "Are you sure what you are saying is happening in Africa?" The image that I've been showing about the multimedia, are they existing in Rwanda? I said, yes. Sometimes the context, before partnering, we need to know the context, the background, what is there, and we can come to support. Number two, it's about the sustainability. some projects, some partnership, they came and they end up with the partners. But whenever we are starting any partnership, we needed to think on sustainability. By the end of the presence of the partners, will really the project sustain? It's another very important point to think on at the early stage. Thank you.
Thank you, everyone. We have 2 minutes for a question. If anyone has any pressing question that they would like to ask our panelists. Well, good. I can say that I hate that we don't have a question. Yes, but thank you, everyone. This was such an insightful and astute conversation around the transformation, like the digital transformation and STEM education. And just to remind all of those who would like to come in and partner, a recap of what we need to remember, or at least what our panelists have reminded us, is to align with the industry and needs of people, and then also align with existing plans. Thank you, everyone. This was a very insightful panel. I appreciate everything you brought to the table, and I believe that all our audience does too. Could we please give a round of applause for our, for our panelists? I will now move on to my other desk. As we come to an end, to the end of 2 very eventful days, we are going to be signing 2 agreements, and the first one is an agreement on joint program collaboration leading to multiple degrees between Seinäjoki University of Applied Sciences and the Rwanda Polytechnic. If those representatives could please come over here for the signing. I'm not sure we're able to sign from here. Do you think we would be? Maybe over there? Yes. Yes. Will this work for the camera people? For the photographers and videographers, sorry. Yes, okay. Thank you. As now we proceed to the signing, I would like for you guys to take your seats, and then we can start with the signing. Thank you, Rwanda Polytechnic, and if you could still stay here as thank you very much. We have another agreement that needs signing, and it's between the Seinäjoki University of Applied Sciences and the Catholic University of Rwanda. If the representative could please come up front. Thank you, Doctor. Thank you, Vice Chancellor. And another round of applause for these wonderful collaborations that have... Yes, thank you. And as we come to a beautiful end and towards the end of our forum today, and as we remember that today was focused on two key thematics, health and education. We're going to hear closing remarks, starting with Prof. Claude Mambo Muvunyi, the Director General of Rwanda at the Biomedical Center. You're welcome.
So thank you very much, moderator. I think after this very nice signing of the agreement, I think we should celebrate. This, I think, is one of the great achievements of this gathering, which I think is only the beginning of many things to happen. And also, I just want to again appreciate all of you for really staying until this time for these very important meetings. My name is Claude Muvunyi, as the moderator said. I'm the Director General for Rwanda Biomedical Center, which is one of the main implementing agencies under the Minister of Health. So it's really an honor and also at the same time a challenge for Rwanda Biomedical Center and the health sector in general to really follow the rich and also very moving discussions that have taken place today. And as was mentioned during the opening remarks this morning, and this forum, as you can see, all represents a merging of ideas and also many perspectives from the beginning. And one of its greatest strengths is that I think has brought many actors from the government, academia, and also private sector, and also development partners together, which I think we don't see often to be in the same room discussing on a very important topic. And I think this is, again, creating a space for dialogue, which is there. I think is one of the important achievements for this 2 days gathering. But my sincere hope is that this forum becomes the very first step in turning many conversations that we've had today into meaningful partnership. And we've heard many times partnership coming into the discussions, and I hope that we'll be able to get really tests from these discussions where we want to move from dialogue to collaboration, but also moving from strategy to many implementations. So Rwanda's health system has really also made a very important progress. I think we have heard from the Minister of Health this morning and also from some of our previous speakers about many achievements that we've made. If you want to consider, for example, where in Rwanda we've been able to maintain the HIV prevalence at 3%, which I think is a good achievement. And we're doing that through a very good achievement by making sure that more than 95% of our patients are under antiviral treatment. And we've also been able to achieve the 90-90-90 target of UN AIDS. At the same time, also, we've been able to really increase the screening of our communities for TB using very technology, but also employing the community health workers at really front line of our health system. At the same time, also, those community health workers are able to treat 90% or 80% of malaria cases within the communities. But again, these achievements, of course, we've also made a very good improvement, as our minister mentions, around making sure that most of our women deliver at healthcare facilities with very well-trained healthcare providers. And also, we've been able to really sustain efforts in our health, our nutrition, but also in our community-based programs. So these achievements are very important, of course, but they also highlight some new realities. And like many other countries, Rwanda is now facing a change in the infectious disease epidemiology, where we are now seeing an increase or much more burden in non-communicable diseases as we continue to also deal with those important infectious diseases. And as of today, the minister, the ambassador said that we've been able to have a very good coverage in HPV vaccinations as our effort to fight against cervical cancers. This is really a very good achievement, as Rwanda is among few countries being able to really achieve that coverage. And we're also now putting a much effort in making sure that we increase the number of women who can be screened and also be linked to treatment. Of course, as of today, if you've really followed the news, we've been able also to follow the example of Sweden to really implement the Gardasil 9 vaccines among women. So this, again, one of our tools. We want to make sure that we continue to address these very evolving issues of cervical cancer in our community. Again, so we can all understand that addressing this evolving health landscape will require, again, continued collaboration, innovations, and also research. And this brings me to a very important point that has come up repeatedly during our discussion today, the role of research and how do we really strengthen research and collaboration around very meaningful research. So we need more operation research that will directly address the challenges we faced in our health system. Too often, and this has been also discussed during the panel, where we know that many of our research findings end up in sitting in those shelves. Instead, our research should really continue to inform our policies and also guide our programs and also ultimately improve the service that we want to be reaching our populations. And very importantly, quality health care, as one of the speakers alluded to, is also contingent to quality educations. So if you want a very strong health system, we also want to invest more in strong academic institutions and also very strong training programs. And I hope that the Vice Chancellor will come back to that and take very good lessons and recommendations for these discussions. As I'm speaking, Rwanda is also continuing to work to really strengthen partnership between universities and also research institutions like RBC. And the goal is not simply, as I mentioned, to produce research, but to really produce research that contributes meaningfully to solving problems in our countries, in our communities. I was very pleased to hear from the Health Tech Initiative at Shama Universities or Technology Institutions in collaboration with Rwanda. We've also heard about the new PhD hub, which is going to be launched very soon between Danish universities and also Rwandan universities. And also very important is also the EU Twimming project, among others, that we've really been enjoying to hear the achievements so far, but also what is planned for the next path of the collaborations. So again, this is a promising start to start the type of collaboration that will move both Rwanda and also partners in Nordic countries forth and collectively. At the same time, we are also entering a period where technology will increasingly shape the future of health system. And we also heard from the last and recent panel that digitization is something that we need probably to involve in our interventions. And for health, it's a very particular tools that we are trying to really now bring on as we continue to implement and fill those gaps that are still remaining in our health system. But most importantly, artificial intelligence, which has been also mentioning and also is coming up. And we are seeing already some level of transformations and on how we conduct the type of intervention, the surveillance, and also how do we speed up also analysis of data and also deliver care, as I said. So in this area, again, we hope that will continue to see the same partnership with Nordic and also Baltic countries, which I think is really promising, as I said. And your countries, we've heard and we've seen some good and strong experience that we have showed in really making sure that the innovation ecosystem is really something you have experienced in. And also, probably in this partnership, we want to make sure that we continue to really bring research into the benefit, and also making sure that we translate all those scientific advances into practical solutions. I think there is much we can learn from each other, and ultimately the success of this forum will depend on what happens after we leave this room. And if this gathering succeeds, it will not simply be remembered as a meeting where interesting ideas were shared, but it's also going to be remembered as the moments when a new partnership have seen today, and we want to see more partnership coming out of these discussions. And also those partnerships will also continue to take shapes. And also, again, my hope is that when we meet again at the next summit, we will not only be discussing ideas, but presenting concrete initiatives that have emerged from relationships that we build here today. So let me conclude by thanking all of you, our excellencies, for making sure that we have this opportunity to continue to engage, to collaborate in a very openness way, but also we leave this room with the commitment to continue to have these collaborations. So the foundation has been laid, and we all have the next step, which I think is to really build this partnership and this foundation together as we continue to implement what we have discussed today. Once again, I want to thank you very much for your time, and want also probably to wish you, as the minister said, to also take the time to enjoy the city, the country, and we hope again to see each other again very soon. So thank you very much again for everyone, but especially for the moderators who have been really very instrumental to really moderate these sessions. So thank you very much again.
Thank you very much, Professor. And let us all remember what he just said, that the success of this forum is going to be remembered by what happens when we get out of this room, not what we have said in this room. So let us drive those collaborations. And for our last remark of the day, and again, as it was health and education, and we just heard from the health sector, I would like to invite Dr. Didas Kaihura, Vice Chancellor of the University of Rwanda. You're welcome, sir.
Thank you so much, moderator. But if it wasn't to be that it is a conference convening for health and education, I wouldn't even mind leaving it to Prof. Muvunyi, because he said it all almost. But because that's how you said it, you go as the protocol deserves. Excellencies that were here, and those others that are still here, those from Nordic countries, ambassadors, representatives from Nordic countries, and different institutions, including universities and other research and higher learning institutions from the Nordic and Baltic countries, representatives of the government of Rwanda and government institutions here present, and those that were present here before, distinguished academic leaders, business leaders from Rwanda, ladies and gentlemen, all protocol observed, good afternoon once again. As we come to the close of day 2 of Rwanda Nordic and Baltic Forum, allow me to extend my sincere appreciation to each one of you for your presence, your insights, and your active participation throughout the day's discussion. And more importantly, for those of you who are still with us, a special thank you. Over the past 2 days, we have witnessed dynamic and forward-looking discussions that reaffirm the strong and growing partnership between Rwanda and Nordic-Baltic region. This forum that the University of Rwanda is proudly part of, for the second time, if there are some of you, I'm sure some of you were here last year, has again brought together policymakers, investors, innovators, researchers, and development partners to explore opportunities for sustainable growth, innovation, and knowledge exchange. We are particularly happy that it is growing, both in terms of numbers of those that are participating, but also widening and broadening themes that are being covered during the discussions. Here today and yesterday, we have demonstrated the value of bringing together universities, industries, and policymakers, together with innovators from Rwanda and Nordic-Baltic regions, to share common vision for progress and sustainable development. Yesterday, which was on day one, the discussions highlighted Rwanda's ambition to position itself as a regional hub for investment, finance, and trade, while also serving as a gateway for SME growth across Africa. The intention was that we show what we can, we invite and we interest you, people from Nordic and Baltic region, to invest in Rwanda, to develop from Rwanda, but also targeting growing broader across Africa. Africa is always ready for development partners, for investments, and Rwanda in particular, we are ready to partner with you to get to that ultimate goal. Participants also explored opportunities in talent development, digital services, innovation ecosystems, and emerging technologies such as artificial intelligence and the future of 6G connectivity. A few years ago, we were talking about 5G, and today we are into those discussions. Today, the forum focused and expanded to the role of education, research, health systems, and innovation ecosystems in strengthening sustainable partnerships. These discussions emphasized the importance of global health collaborations, university-industry partnerships, digital transformation, and STEM education in preparing societies for the future. Altogether, these conversations, that's for yesterday and today, reaffirm a shared understanding that the future of investment, global health, education, research, and innovation depend on strong partnerships, bold ideas, and sustained collaboration across institutions, sectors, and continents. So, I take also this opportunity to highlight that for many years, the University of Rwanda has particularly benefited from the strong and productive relationships between Rwanda and the Nordic countries, relationships that are built on mutual respect and a shared commitment to addressing global challenges. A notable example, of course, is our partnership with Sweden, with the well-known bilateral research cooperation through the UR Sweden program, for which in 2023, we celebrated the 20th anniversary. So we are talking about 23 years now down the road into that wonderful partnership with numerous achievements on record. At 23 years old, I'm talking about the partnership, over 100 PhDs have been achieved. They have been trained, and we have also been enjoying fruitful collaborations with universities from other Nordic countries, Finland, Norway. In the morning they were talking about our relationship with Norway, the University of Oslo, And I'm happy to say that even now our manager of research unit, what we call SPIU, that manages all those projects, is a very recent graduate from University of Oslo. But you saw the professor here, Maurice from Agder University. We collaborate a lot, and he's at the same time our faculty member here, and many others. And we are now gearing up to expand and deepen our cooperation with Denmark and many into Finland. You heard about the great partnerships with institutions such as Aarhus University and the University of Copenhagen that are opening new opportunities in areas such as global health, data science, geospatial artificial intelligence, and many others. So the partnerships are growing and are expanding to many and more countries. Today's forum, therefore, has once again demonstrated the value of such partnerships, and more importantly, it has created space for new collaborations while strengthening the existing ones. We have just witnessed the signing of an understanding, an agreement between one university from the Nordics and 2 universities from Rwanda. The relationships and conversations initiated that have potential to lead to impactful research initiatives, innovative programs, and long-term cooperation that will benefit our institutions and societies at large. At the University of Rwanda, we firmly believe that partnerships remain one of the key drivers of growth in higher education, particularly in research, as Prof. Muvunyi just mentioned, and innovation and capacity building. We therefore remain fully committed to fostering these collaborations, facilitating dialogue between researchers and industry partners, and creating opportunities that enable institutions and individuals to grow together. Allow me also to express our heartfelt appreciation to our distinguished participants, all of you who participated, and the guests especially from the Nordic and Baltic universities, industry partners, for your continued commitment to strengthening the ties between Rwanda and the Nordic countries. Your presence here and commitment have made this forum truly meaningful. I would also like to sincerely thank the Embassy of Rwanda in Nordic countries for the initiative. I wish I could say this in the presence of Ambassador Diane, for the initiatives and its excellent leadership in coordinating this forum and for its continued effort in linking Rwanda with partners across the Nordic and Baltic region. This second edition of the forum was built on the memorandum created during the first Rwanda Nordic Forum held in April last year, which laid the foundation for stronger cooperation between our regions. Our appreciation also goes to the Rwanda Development Board, Trademark Africa, the University of Rwanda teams, Hills Connect, moderator, Rwanda Diaspora in Finland, and many others that laid a lot of support to the connections with universities in Rwanda and universities in Finland and beyond. All the technical teams behind this, in other words, that made this event possible, and the team that made it live streamed all over the world, and many others of you, those of you who dedicated your time and collaboration to make this happen, I want to say thank you very much for all you did. My gratitude also goes to the Excellencies, ambassadors, and honorable ministers for them honoring this forum with their presence and for the continued efforts in strengthening international cooperation. Finally, I would like to thank all of you presenters, panelists, moderators, organizers, and participants whose contributions made these 2 days' discussions rich, insightful, and productive. As we conclude this forum, I sincerely want to let us carry forward the spirit of collaboration, like everyone said, and to re-echo what Prof. Muvunyi said. We want to meet again next year when we are finding concrete concrete outcomes out of our great discussions here. The true impact of this gathering will not only be measured out of these conversations that we have had, but also out of those products, tangible, visible, that we shall be seeing. So once again, I want to thank you all for your participation and commitment, and I wish our distinguished guests from Nordic and Baltic countries an enjoyable stay in Kigali. As earlier today, Honorable Minister said, please do not just spend all your time with this conference. Find some good time as well to enjoy Kigali or even beyond. Move around. Have a fantastic and memorable day 3 tomorrow, and safe travels back home. Thank you very much for your kind attention.
Thank you very much, Vice Chancellor. And not to, of course, disrupt what he just said, but if you're still here on the weekend, there is also an event, a conference on early childhood education. It's on Friday the 13th and Saturday the 14th. And the info about that event is going to be found on our website's forum, like the forum's website, on the post event. Then you can find the info. But of course, thank you very much, very, very much for being here. It's been an honor and a pleasure to host and moderate you guys for the past 2 days. And hope to see you again soon in Kigali. Thank you, everyone. We hope you enjoy your stay in Rwanda, and we hope you get to see our beautiful country of Rwanda. And we hope we were hospitable enough. See you all.